Allora, eccoci, siamo qui. Buongiorno a tutti, benvenuti a questa terza, diciamo così, edizione di questo appuntamento internazionale sull'health literacy e sull'alfabetizzazione sanitaria, quindi. Salutiamo innanzitutto la ministra Eugenia Roccella, la ministra per la famiglia, la natalità e le pari opportunità, il ministro della salute Orazio Schillaci e il direttore dei diritti sociali, della salute e dell'ambiente al Consiglio d'Europa, Rafael Benitez, che aprono questa terza edizione. Salutiamo tutti i presenti, tutti coloro che interverranno dopo a rappresentare i vari stati, i governi, istituzioni, i relatori e questa comunità internazionale che si è venuta formando in questi anni intorno a questa tematica. Prima di passare la parola ai ministri, volevo ricordare da dove veniamo, cosa è successo negli anni precedenti. Tutto questo è nato dal lancio che è stato fatto presso il Consiglio d'Europa della guida sulla health literacy nel 2023 e in quell'occasione a Roma, proprio il 12 dicembre del 2023, si è tenuta la prima conferenza internazionale. Il titolo era Health Literacy e Human Rights, Trust Building and Equitable Access to Healthcare, e organizzata da l'UNAR. Il direttore Mattia Peradotto in questi anni è stato l'anima di questi tre eventi insieme ai suoi collaboratori dell'UNAR e insieme all'esperto Lorenzo Montrasio, che sono presenti e che hanno costruito nel tempo questa comunità intorno all'health literacy. Ma l'UNAR non ha lavorato da solo, con il partner fondamentale che è il Consiglio d'Europa. Il Consiglio d'Europa è proprio la sede nella quale è stata ideata, elaborata la guida, è stato raccolto il primo nucleo di esperti e tutto questo è stato fatto in sede di Consiglio d'Europa e poi rilanciato dall'Italia subito con il sostegno del Ministero della Famiglia, della Natalità e delle Pari Opportunità e del Ministero della Salute. Dopo il lancio del 12 dicembre del 2023, l'anno successivo, l'anno scorso, abbiamo fatto la seconda conferenza internazionale, sempre con UNAR, Consiglio d'Europa e i due ministeri competenti, e in questo caso abbiamo sottolineato ancora una volta il legame che c'è fra alfabetizzazione sanitaria e diritti umani e abbiamo riaffermato l'impegno a costruire una coalizione proprio internazionale come modello di inclusione e contrasto alla discriminazione. Alla conferenza già lo scorso anno hanno partecipato rappresentanti istituzionali di Albania, Grecia, Portogallo, San Marino e Turchia, quindi questo primo nucleo di stati interessati al progetto. E quest'anno, i primi di giugno, il 4 giugno a Strasburgo, si è tenuta una colazione di lavoro presso la rappresentanza permanente d'Italia presso il Consiglio d'Europa e finalizzata proprio a promuovere questa iniziativa internazionale e a avviare questa definizione della futura coalizione. Con la partecipazione delle delegazioni dei paesi appunto già presenti che ho nominato prima alla conferenza di Roma del dicembre del 2024. Nel frattempo l'Italia, tramite l'UNAR, ha avviato il primo progetto di health literacy. C'era già una comunità di health literacy in Italia e li abbiamo conosciuti i nostri esperti da Firenze, poi li incontreremo, li ascolteremo nel corso della giornata. L'UNAR ha ideato e finanziato un progetto già, integrazione sanitaria della popolazione Rom e Sinta, con un budget di 2,7 milioni di euro all'interno del Programma Nazionale Inclusione e Lotta alla Povertà 2021-27. Il progetto ha la durata di 3 anni. Gli attuatori sul territorio sono l'Università Cattolica del Sacro Cuore, la Croce Rossa Italiana e il Centro Nazionale Sangue. Gli obiettivi di questo progetto sono migliorare lo stato di salute delle comunità rom e sinti attraverso indagini epidemiologiche, raccolta dati e valutazione dell'accesso ai servizi sanitari, ridurre barriere e diseguaglianze nell'accesso ai servizi sociosanitari potenziando la prevenzione, le vaccinazioni, i controlli pediatrici e le cure primarie, promuovere l'alfabetizzazione sanitaria tramite campagne informative, materiali educativi, contenuti digitali e attività territoriali, rafforzare la collaborazione tra istituzioni, ASL, enti locali, organizzazioni non governative e comunità per migliorare la presa in carico, l'integrazione dei servizi e interventi mirati, contrastare le discriminazioni nell'ambito sanitario, sensibilizzando professionisti e opinione pubblica e valorizzando narrazioni positive e poi sviluppando strumenti operativi, survey, database, moduli FAD, social media, blog, eccetera, per monitorare, formare e per l'empowerment della comunità. Il progetto sta progredendo in modo significativo, è stata definita l'impostazione complessiva dei criteri di comunicazione relativi allo stato di salute delle comunità rom e sinti, con una particolare attenzione alla necessità di standardizzare le informazioni riguardanti gli stili di vita, inclusi soprattutto gli aspetti nutrizionali, le misure di prevenzione come le vaccinazioni pediatriche e le condizioni abitative che possono incidere sul benessere e sui rischi sanitari. Su queste basi si sta costruendo la survey dedicata che verrà sviluppata in collaborazione con clinici di diverse specializzazioni, tra cui pediatria, salute mentale e malattie infettive, ovviamente con il supporto metodologico di esperti statistici. È stata poi, in parallelo, è stato avviato un lavoro di revisione e ristrutturazione del portale informativo del progetto, con un aggiornamento che prevede un ampliamento dei contenuti orientati alla prevenzione e alla corretta fruizione dei servizi del Servizio Sanitario Nazionale. E inoltre anche la predisposizione di materiali in lingua romani su alcuni aspetti ritenuti prioritari e individuati grazie al contributo diretto e al coinvolgimento di collaboratori rom e sinti. Allo stesso modo stiamo procedendo all'aggiornamento della grafica e dell'architettura del sito per migliorarne la fruibilità complessiva. Quindi a questo lavoro che sta crescendo lentamente ma con solidità, e passo subito la parola alla Ministra per la Famiglia, Natalità e Pari Opportunità, Eugenia Roccella.
Grazie e buongiorno a tutti. Desidero innanzitutto ringraziare il Ministro Orazio Schillaci per la sua presenza e per la collaborazione che ha reso possibile questo appuntamento e che non ci ha mai fatto mancare in tutto questo percorso. Un ringraziamento speciale va ovviamente a Rafael Benitez, direttore dei diritti sociali della salute e dell'ambiente del Consiglio d'Europa, per il contributo costante per il sostegno a questo percorso comune. Desidero inoltre rivolgere un ringraziamento alla Ministra per la Salute dell'Albania, Evis Sala, che non è con noi, non sarà con noi in presenza, ma ha mandato un messaggio di cui la ringraziamo, e al rappresentante della Grecia, Vassiliki Karaouli. La loro partecipazione sottolinea l'impegno condiviso verso politiche che promuovano equità, inclusione e tutela dei diritti. Permettetemi poi di ringraziare la mia collaboratrice Assunta Morresi, la professoressa Assunta Morresi, membro italiano del SIDI-Baio e mia vice capo di gabinetto, e il dottor Mattia Peradotto, direttore dell'UNAR, insieme ai suoi collaboratori, in particolare la dottoressa Canevari, e Lorenzo Montrasio per il fondamentale lavoro svolto nell'organizzazione di questa conferenza e nella costruzione del percorso che oggi inauguriamo. Saluto veramente con gratitudine tutti le autorità e i relatori presenti perché la vostra partecipazione testimonia la centralità del tema dell'alfabetizzazione sanitaria su cui ci siamo soffermati anche nei precedenti incontri. Una centralità che è un strumento essenziale per rafforzare i diritti umani e promuovere fiducia tra i cittadini e le istituzioni. Siamo ormai alla terza edizione della nostra conferenza internazionale annuale sulla health literacy, un tema a cui teniamo molto perché interpreta e attua le pari opportunità, la questione delle pari opportunità, del quale esercito la delega politica nell'ambito della cura e della salute, che è un ambito fondamentale per la vita di ciascuno di noi. La health literacy si pone come obiettivo quello di dare a tutta la popolazione gli strumenti per un accesso equo ed efficace alle opportunità di cura offerte dal servizio sanitario, promuovendo la condivisione delle conoscenze fra esperti e cittadini, rendendo concreta la libertà di cura nel duplice senso di essere curati e di curare, e quindi rafforzando la fiducia nelle istituzioni e favorendo la partecipazione alla vita democratica. Non è la stessa cosa dell'informazione sanitaria. L'alfabetizzazione sanitaria è qualcosa di più, è qualcosa che sollecita una più diretta partecipazione e per questo è uno strumento fondamentale di inclusione, perché noi siamo bombardati da informazione sanitaria, quindi ne abbiamo a volte persino troppa e anche questo crea a volte invece un problema nella fruizione dei servizi sanitari. Quindi è qualcosa di diverso e anche semplicemente il termine forse noi dobbiamo anche cercare di diffondere spiegando di che cosa si tratta. Possiamo dire che l'alfabetizzazione sanitaria è un metodo di lavoro nell'ambito dei diritti umani, perché rafforza il legame fra accesso alle conoscenze e accesso alle cure, dando fra l'altro concretezza ed efficacia al consenso informato, che è un altro pilastro che abbiamo rafforzato nel corso degli ultimi anni e su cui si basa tutto il diritto alla sanità. Però appunto questo consenso informato non può diventare anche questo uno strumento meramente burocratico, va in qualche modo reso più fruibile e l'alfabetizzazione sanitaria è un passo fondamentale per rendere il consenso informato effettivo, efficace, vero, fruibile. E renderlo quello strumento giuridico ed etico che garantisce che ogni intervento nel campo della salute avvenga nel rispetto dell'autonomia, della dignità e dei diritti fondamentali della persona. In questo modo la health literacy supera il perimetro strettamente sanitario e investe le politiche di salute pubblica, contribuendo a rinnovarle coerentemente con i nuovi sviluppi tecnologici e scientifici, coinvolgendo trasversalmente molti ambiti della società, dall'educazione alla giustizia fino alle politiche familiari. Una delle parole chiave, accanto a diritto, è quindi fiducia. Fiducia nella conoscenza, nelle istituzioni, la condizione necessaria per poter attuare efficacemente politiche di salute pubblica dove la salute è intesa nell'accezione più ampia, non solo come assenza di malattia, lo sappiamo, ma ormai come benessere della persona nella sua interezza. Altre parole chiave direi che sono prima di tutto proattività, cioè la capacità di intervenire attivamente per sollecitare l'inclusione e l'integrazione. E una parola che mi è molto cara perché proviene dalle politiche delle donne e per le donne, che è empowerment. L'alfabetizzazione sanitaria è una forma di empowerment, quindi qualcosa che va oltre il mero intervento di tipo assistenziale, ma che sollecita anche qui appunto la partecipazione, la sussidiarietà, il protagonismo delle persone a cui viene rivolto. Il nostro Paese ha iniziato questo percorso insieme al Consiglio d'Europa, con cui ha mantenuto in questi anni un dialogo costante, costruendo una collaborazione che oggi vogliamo consolidare e ampliare, come illustreremo nel corso di questa conferenza. Voglio ricordare brevemente, ma è già stato ricordato dalla professoressa Morresi, che il processo è iniziato con il lancio della guida sull'alfabetizzazione sanitaria nel dicembre del 23, alla cui elaborazione l'Italia ha contribuito nell'ambito del CityBio, del Comitato Direttivo del Consiglio d'Europa per i diritti umani nella biomedicina e nella salute. In quell'occasione il Consiglio d'Europa aveva invitato tutti i paesi a intensificare il proprio impegno su questo tema e l'Italia ha voluto cogliere questa occasione, prendere davvero alla lettera questo invito. L'Italia quindi ha organizzato la prima conferenza del 12 dicembre del 23 dedicata alla costruzione della fiducia e dell'accesso equo all'assistenza sanitaria, e la seconda conferenza si è tenuta lo scorso anno, sempre a dicembre, il 5 dicembre del 24 a Roma, con la partecipazione di rappresentanti istituzionali di Grecia, Portogallo, San Marino e Turchia, nonché di diversi rappresentanti della società civile, e ha consolidato il legame fra alfabetizzazione sanitaria e diritti umani, riaffermando l'impegno a costruire una coalizione internazionale. Con questa terza conferenza vogliamo innanzitutto ribadire che l'alfabetizzazione sanitaria rappresenta un pilastro della partecipazione democratica e una condizione indispensabile per l'effettivo esercizio dei diritti umani. Ci richiamiamo per questo ad alcuni strumenti del Consiglio d'Europa, in particolare all'articolo 11 della Carta Sociale Europea, articolo relativo al diritto alla protezione della salute, che stabilisce fra l'altro che l'accesso alle cure deve essere assicurato senza discriminazioni. All'articolo 3 della Convenzione di Oviedo, pilastro da questo punto di vista sull'accesso equo alle cure sanitarie, che stabilisce che le parti, tenuto conto dei bisogni di salute e delle risorse disponibili, prendono le misure appropriate in vista di assicurare. Ho perso un foglio, ecco. Di assicurare nella sfera di giurisdizione un accesso equo a cure della salute in qualità appropriata. In questa prospettiva vogliamo sottolineare la necessità di proseguire il lavoro avviato. E quindi oggi avviamo la costruzione di una coalizione dedicata all'alfabetizzazione sanitaria e ai diritti umani. È quasi più facile dire health literacy. La coalizione di Roma, questo è il nome che proponiamo, mira a rafforzare il legame fra decisione politica e cittadini, coinvolgendo le istituzioni e prestando particolare attenzione alle persone e ai gruppi in situazioni di vulnerabilità. A questo fine invitiamo quindi il Consiglio d'Europa a coordinarne e rafforzarne ulteriormente le azioni in questo senso, richiamando la disponibilità dell'Italia a contribuire in modo concreto allo sviluppo di questa attività, allargandola per costruire, mi è stato ricordato dal dottor Montrasio, un modello che si possa riflettere anche in altri ambiti, proprio partendo dalla capacità di sollecitare il protagonismo delle persone e dei gruppi a cui ci rivolgiamo. Quindi, buon lavoro.
Allora, grazie anche per aver sottolineato ancora una volta la differenza che c'è tra informazione sanitaria e invece health literacy, alfabetizzazione sanitaria, e forse in effetti il termine inglese suona più ampio dell'alfabetizzazione sanitaria, forse sarà perché sono abituato più a sentirne il respiro più ampio, e soprattutto grazie per averci appunto aver messo un nome a questo terzo passo, cioè il nome che è la coalizione di Roma che vogliamo costruire e di cui vogliamo iniziare appunto la nominiamo così come è da oggi. Come passo importante.
Ti interrompo un attimo perché voglio aggiungere una cosa, irritualmente, vabbè.
Fa niente.
Che l'alfabetizzazione sanitaria, anche health literacy, porta con sé questo significato, vuol dire la capacità di lettura delle informazioni. L'alfabetizzazione è questo, è la capacità di accedere poi non soltanto all'informazione che ti viene data, ma alla capacità di decifrare l'informazione e quindi di impadronirtene. Questo penso che sia il senso dell'operazione che stiamo cercando di fare ed per questo ci teniamo tanto. Grazie.
Ringrazio per questa ulteriore preziosa precisazione, e adesso ascoltiamo il Ministro della Salute Orazio Schillaci. Grazie.
Grazie, buongiorno a tutti. Saluto la Ministra Eugenia Roccella, il Direttore dei Diritti Sociali, della Salute e dell'Ambiente al Consiglio d'Europa Rafael Benitez, la Professoressa Assunta Morresi, tutti presenti. Poi ringrazio la Presidenza del Consiglio dei Ministri, l'Ufficio Nazionale Antidiscriminazioni Razziali e il Consiglio d'Europa per aver dato continuità a un percorso che oggi entra in una fase nuova, come abbiamo appena sentito, con la nascita della Coalizione di Roma. Negli ultimi anni abbiamo visto con chiarezza quanto la conoscenza influenzi la capacità di orientarsi, di compiere scelte ponderate, di affrontare in maniera consapevole percorsi diagnostici e terapeutici. L'alfabetizzazione sanitaria è il filo che tiene insieme fiducia, partecipazione, diritto alla salute. Non parliamo solo di concetti medici, ma della possibilità concreta di comprendere ciò che riguarda la propria vita e quella dei propri familiari. Quando il diritto a un'informazione chiara non è pienamente assicurato, i percorsi di cura si complicano, le diseguaglianze si ampliano e cresce anche il disorientamento. I riferimenti citati dallo Statement of Intention ricordano che la tutela della salute è inseparabile dalla dignità della persona, dal corretto funzionamento delle nostre democrazie. L'articolo 11 della Carta Sociale Europea, l'articolo 3 della Convenzione di Oviedo, che prima ricordava la Ministra Roccella, richiedono con chiarezza la responsabilità delle istituzioni nel permettere ai cittadini di partecipare pienamente alle decisioni che li riguardano. E la roadmap del Consiglio d'Europa indica la stessa direzione. Questo è un orizzonte che pienamente condividiamo. La giornata di oggi segna quindi un passo importante. La coalizione di Roma nasce per unire istituzioni, organismi internazionali, comunità scientifica, società civile. Si crea una rete che rafforza il dialogo tra chi definisce le politiche e chi ogni giorno deve orientarsi tra cure, prevenzione, un ambiente mediatico dove le informazioni corrette convivono anche con tesi prive di fondamento scientifico. Nella nostra nazione questa sfida è evidente. Una parte significativa della popolazione fatica purtroppo a valutare ciò che legge, a distinguere le fonti attendibili, a capire come muoversi nel sistema sanitario. È un fenomeno che riguarda tanto gli adolescenti quanto gli adulti, in particolare chi vive condizioni socio-economiche fragili o incontra barriere linguistiche e culturali. In questi casi una scarsa comprensione può tradursi in ritardi nei controlli, in una minore adesione agli screening e nelle difficoltà nel seguire le terapie essenziali a volte, un crescente senso di distanza dalle istituzioni. Per questo il Ministero della Salute ha rafforzato le iniziative dedicate alla chiarezza delle comunicazioni pubbliche rivolte ai cittadini, al rafforzamento della capacità dei professionisti di dialogare con i cittadini stessi. In particolare il ruolo dei medici di famiglia e dei pediatri è fondamentale. Il loro rapporto diretto con i pazienti permette di affrontare dubbi, paure, scelte delicate con una serenità sicuramente maggiore. Stiamo poi potenziando le infrastrutture digitali che rendono più immediato l'accesso ai propri dati sanitari e migliorano in maniera significativa l'assistenza. Fascicolo sanitario elettronico, telemedicina ampliano le possibilità di cura, ma perché portino benefici reali è necessario che tutti dispongano delle giuste competenze per utilizzarli appieno. Per questo investiamo anche nella formazione dei professionisti sanitari, consapevoli che una comunicazione chiara e vicina alle persone sostiene la relazione di fiducia che ogni sistema sanitario deve coltivare. Il lavoro che l'Italia porta avanti con il Consiglio d'Europa risponde a questa esigenza. La coalizione di Roma, sono certo, offrirà uno spazio stabile per condividere esperienze, individuare ostacoli, costruire strumenti che aiutino a leggere con precisione i bisogni delle persone, in particolare di chi vive condizioni di vulnerabilità. Non si tratta di produrre qualche documento in più, ma di definire pratiche comuni capaci di incidere sulle decisioni e di radicare le politiche nella vita quotidiana dei cittadini. Ringrazio chi ha lavorato all'organizzazione di questa conferenza, chi interverrà nelle diverse sessioni e sono sicuro che il confronto di oggi offrirà un ulteriore contributo concreto alla costruzione di una visione condivisa fondata su ascolto, equità ed inclusione. Il Ministero della Salute continuerà a impegnarsi in questa direzione. Grazie e buon lavoro a tutti.
Allora, grazie al Ministro Schillaci perché ci ha fatto vedere come si declina poi nei vari aspetti, in tutti questi passaggi a cui ha accennato appunto nel corso, cioè nel corso del suo discorso, proprio in tutti i vari passaggi, come concretamente poi si attua l'health literacy a partire dal lavoro all'interno del Ministero della Salute e all'interno del Servizio Sanitario Nazionale. Cioè tutto ciò che ha parlato, tutto ciò che ha detto va nella direzione innanzitutto, il primo passo, di una adeguata comprensione di ciò che viene offerto dal Servizio Sanitario Nazionale, ma ha parlato anche di un rapporto diretto fra gli operatori e i cittadini. È questo che diciamo lo strumento principe dell'health literacy su cui la coalizione lavorerà. E ringrazio per aver anche ricordato l'importanza della coalizione che parte oggi e quindi nella fiducia che ha mostrato sempre in questo percorso. Passo adesso la parola al nostro interlocutore principe del Consiglio d'Europa, Rafael Benitez, direttore dei diritti sociali, della salute e dell'ambiente, appunto al Consiglio d'Europa. Grazie.
Qui, va bene. Allora diceva grazie signora moderatora, signora ministra, signor ministro, eccellenze e amici. Sono molto onorato di essere qui in rappresentanza del segretario generale e di portare il suo auguri a questa conferenza. Come sapete magari, il segretario generale era prima di essere segretario generale del Consiglio d'Europa, ministro della salute, ministro dei diritti sociali, ministro dell'integrazione in Svizzera. Così questo messaggio che porto del signore Alain Berset è quello di grazie. E quelle sono anche le mie parole agli italiani. Grazie e autorità italiane, grazie per questa iniziativa, grazie per questa conferenza, grazie per tutto che fai per la, voleva dire, alfabetizzazione alla salute, ma anche ho visto che ci sono queste diverse parole, conoscenza, educazione, cultura, informazione. Così sono contento di continuare in inglese. Dear ministers, excellencies, ladies and gentlemen, it's a distinct pleasure to be here and to join in this important occasion, the third time we come together under the leadership of the Italian authorities. So big thanks to them for this leadership. Big thanks to them for the initiative they take in this important sector. Health protection is both a human right and a cornerstone of democracy and social justice. It is a shared responsibility requiring sustained political will, cross-sectorial cooperation, innovative and human rights-based solutions, all of which we see here. These were some of the important conclusions of the recent Council of Europe Conference on Health that we held in Strasbourg on 15th October this year. The protection of health is built on a long-standing legal system of standards which underpin states' parties' commitments to health protection in the Council of Europe setting. These include, among others, ensuring access to life-saving care and non-discrimination, and this in the framework of the European Convention of Human Rights. It also includes, as we've heard, removing the causes of ill health in the framework of the European Social Charter, which, as we have heard, contains the vector for the work of the Council of Europe in the area of health protection and health promotion, Article 11 of the European Social Charter. It also includes safeguarding patients' dignity, integrity, and autonomy, including those in vulnerable situations. And these we do inter alia in the framework of the Oviedo Convention. It also includes protecting the quality and safety of medicines, work that we do in the framework of the Convention on the European Pharmacopoeia. It also includes combating counterfeiting of medical products and fighting organ trafficking, something we do in the framework of two distinct criminal law conventions which protect public health, the Medicrime Convention and the Santiago de Compostela Convention, to name but a few. The protection of health lies at the heart of the implementation or the contribution of the Council of Europe to the implementation of United Nations Sustainable Development Goals, in particular, Sustainable Development Goal number 3 on access to health and sustainable development overall. So how does health literacy come into play? And as I said, I'm really happy that the Council of Europe works only in 2 languages, English and French. I think we don't have a problem with the terms in English. We know them. Now, we will see how we go about the terms in French, but I can see already how fascinating and how enriching this discussion is going to be. Because on the way here, I was discussing with some ambassadors, including the representative of the Holy See to the Council of Europe, about the use of terms and how much they carry and how sophisticated these terms are. We've heard now how enriching the discussion is in Italian. You can imagine how enriching it would be in Greek. Some of these terms carry so much weight, culture, υγεία, Sophia, that it already shows the importance of what we are discussing and how fundamental these terms, how fundamental health literacy is for the enjoyment of human rights. So health literacy is indeed a determinant factor in ensuring health protection. As stated in the Council of Europe Guide on Health Literacy that we have heard about already, it entails people's knowledge, motivation, and competencies to access, understand, appraise, and apply health information to make judgments and decisions in every life concerning their health, concerning the prevention of disease, and concerning the protection of health for themselves and for those around them. It's also about empowering them, giving them what they need to make informed decisions and be active contributors of their life, including their health. By actively listening and precisely empowering people, as the minister said, in matters concerning their health, illness can be prevented or mitigated, hospitalization rates can be reduced, and adherence to treatments can be improved. In other words, health literacy can reduce errors when taking medication, leading to increased hospital admissions and longer stays. It can reduce the use of emergency services for non-urgent conditions, something we all know, clog emergency departments, and probably is a nightmare for the health minister. And it will also avoid unnecessary repeat visits by helping patients prepare for medical appointments, asking critical questions, and understanding discharge instructions. Yet, health literacy remains a global challenge. And why is that? Is it because we don't attach importance? Is it because we don't see the use of it? Is it because it's difficult to understand? When we look at the figures, we see that in fact, in Europe, 47% of the population has limited health literacy. People with low health literacy find it difficult to know where and when to seek appropriate healthcare services, and they are less likely to seek preventive care and manage their health poorly and often face high mortality rates. Further, health systems become more and more complex. They involve additional digitalization, the use of new technologies, and diverse care setting. Individuals, therefore, must be equipped with the elements that will allow them to critically interrogate information, understand the rights and options, and participate actively in decisions affecting their health. But this is also about money, and a lot of money. And perhaps this is also an opportunity to raise awareness about the critical importance of health literacy. Prior to the conference, we were discussing with the director of UNAR about some of his figures, and in fact, they are quite telling. In fact, the latest studies that we have, recently published by The Economist, show that the cost of health literacy, or rather the absence of health literacy, could amount to as much as 0.4% of a country's GDP. And this, for Italy, is in the order of 10 billion euros. We've also seen that this, in other studies, amounts to 3 to 5% of the total annual healthcare budget. Here we're talking about 5 billion euros. So there is money. And this is very relevant because today, more than ever, our social protection systems, including our health systems, are under strain. And we need to ensure their sustainability. So if we can increase health literacy and we can use that money to make more sustainable health systems, we have an answer which serves two purposes, which protects human rights, which empowers individuals, which makes their health better, and which at the same time allow us to save money and inject that money into better care systems. And as the ministers have said, it is possible to contribute to better health literacy by, inter alia, raising public awareness of health information and services, reaching out to persons in vulnerable situations, reconnecting those who are disconnected from healthcare settings, whose opinions have been skewed by disinformation. By promoting trustworthy health information, we will improve their knowledge and the understanding of risks to health. We can also improve health literacy by providing easy-to-understand scientific and clinical information to patients. And we can also do so by promoting respect for people and patients from different backgrounds, by training health professionals to be more culturally sensitive when caring for people both in and beyond healthcare systems. We can also contribute to better health literacy by coordinating health strategies, including health literacy strategies at all levels, including local and regional level, so that health needs of individuals and communities are better targeted and tailored. I come to the conclusion, ministers, ladies and gentlemen. Safeguarding and protecting health is both a human rights obligation and an investment in Europe's democratic future. Protecting health requires going the extra mile and giving individuals the skills, confidence, and understanding that allows them to engage meaningfully with health information, to distinguish reliable sources from mis- and disinformation, and to make informed decisions about their care. Promoting health literacy is essential for the protection of individuals and for the protection of public health. But it also goes beyond health and the health field and contributes to the personal autonomy and empowerment, as we heard, of all citizens, contributing thereby to the building of trust in and the strengthening of our democratic societies. Today, building on the valuable initiatives and the outputs of the Italian authorities and the outputs of the two previous conferences organized here in Rome on health literacy and human rights, we have an opportunity to develop initiatives that respond to the needs of diverse populations and support a patient-centered, rights-based approach to healthcare. And I am again thankful to the Italian authorities and in particular to the ministers for their initiative to launch the Rome Coalition. I think as we move forward, I dare to say that we have now an opportunity to build on the Rome Coalition and to build on your initiatives in this eternal city and to take it to another city which is perhaps not Italian but has an Italian name, Argentarium, the old name of Strasbourg. And therefore move this coalition of Rome to make it the coalition of silver, the Argent coalition, and to move it to Strasbourg so that we can build on this incredible initiative that the authorities of Italy have taken with the support of many institutions and reach out to the 46 member states of the Council of Europe. We have a unique opportunity. Health literacy has been identified as one of the priorities resulting from the health conference. And I'm also very pleased to announce that next year's health conference of the Council of Europe will be devoted to health literacy so that together we can contribute to a better future for today's and future generations. Thank you very much for your attention.
Allora, ringrazio il direttore Benitez per questo intervento che ha inserito l'health literacy all'interno dell'architettura del Consiglio d'Europa e ha dato appunto, soprattutto ricordandoci che l'health literacy sarà un punto fondamentale e noi quindi ne saremo protagonisti grazie al lavoro di questi anni, e anche ringrazio per il respiro che ha dato in quel accenno ai diversi significati nelle diverse lingue proprio dell'espressione health literacy, che spiega quanto vada oltre la tecnicità dell'informazione, ma sia proprio una dimensione di conoscenza. Quindi ringrazio, ma adesso noi restiamo qui perché invito la dottoressa Agnese Canevari ad ascoltare, a presentare i saluti, gli interventi di altri invitati e presenti a questa conferenza che danno il loro contributo. Non so se il Ministro ci deve lasciare, loro no. Arrivederci. Grazie Ministro.
Buongiorno a tutti e a tutte. È per me un onore oggi, insomma, assumere il ruolo di moderatrice di questa sessione introduttiva. Molto è stato detto, di molto autorevole in questo tavolo ministeriale. Allora, desidero esprimere innanzitutto un sentito ringraziamento alla Ministra per la Famiglia, la Natalità e le Pari Opportunità, al Ministro della Salute, al Consiglio d'Europa per il sostegno garantito a questa iniziativa e la costante e qualificata collaborazione. Rivolgo inoltre un ringraziamento a tutte le autorità presenti, ai rappresentanti delle istituzioni e della società civile. Particolarmente significativa è la presenza oggi di rappresentanti istituzionali di paesi che condividono l'importanza di avviare questo percorso in cooperazione col Consiglio d'Europa. Grazie. La loro partecipazione conferisce un valore politico e istituzionale ai lavori odierni e testimonia un impegno condiviso, come è stato detto, nella prospettiva di costituire una coalizione, la coalizione di Roma sotto l'egida del Consiglio d'Europa, quale piattaforma stabile di collaborazione sui temi dell'alfabetizzazione sanitaria e dei diritti umani. Questa conferenza, come si è detto, è giunta alla terza edizione, si colloca in prossimità della Giornata internazionale dei diritti umani e richiama quindi il nesso imprescindibile tra tutela della salute, dignità umana e diritti fondamentali. Già è stato detto molto, l'alfabetizzazione sanitaria rappresenta infatti una condizione essenziale per l'attuazione effettiva dei diritti umani. Garantire alle persone la possibilità di comprendere, valutare e utilizzare le informazioni relative alla propria salute significa rafforzare l'autodeterminazione, contrastare disuguaglianze e discriminazioni, promuovere inclusione sociale e coesione e accrescere anche la fiducia nelle istituzioni. È quindi una componente imprescindibile delle politiche, come abbiamo sentito, delle politiche pubbliche orientate all'equità nell'accesso alla salute. I principi che ispirano i lavori di oggi pongono proprio al centro questa visione. Riaffermare il diritto alla salute è indissociabile dalla dignità umana, dalla democrazia, dalla solidarietà, e anche che una cooperazione internazionale coordinata è indispensabile per renderlo pienamente effettivo, proprio in una logica di rete che vede coinvolti i diversi attori politici, istituzionali e anche della società civile. E quindi con questo spirito invito appunto le autorità di 2 paesi strategici nella realizzazione di questo progetto appunto a presentare le loro considerazioni sull'importanza di questa iniziativa. Come ha anticipato la ministra Roccella, la ministra Evis Sala, ministra della Salute e degli Affari Sociali dell'Albania, non è potuta essere presente per un impegno istituzionale, diciamo emergenziale dell'ultimo momento. Siamo stati appunto avvertiti ieri sera, ma per il tramite della sua vice ministra Adana Seferi, scusate, ci ha mandato un video e chiederei appunto ai tecnici di trasmetterlo.
Distinguished ministers, esteemed colleagues, representatives of the Council of Europe, ladies and gentlemen. Allow me to begin by expressing our deep and sincere apologies for not being able to join you today. I convey my own regrets as well as those of the Minister of Health and Social Welfare of Albania, Professor Dr. Evis Sala, who very much wished to attend, especially in response to the gracious invitation extended by Minister Eugenia Maria Roccella, but is prevented by urgent national commitments. We are grateful for the opportunity to share this message and to reaffirm Albania's commitment to your important work. Albania attaches great importance to this conference on health, literacy, and human rights, particularly as it initiates the process leading to the Rome Coalition on Health, Literacy, and Human Rights. We commend Italy's leadership, including the strong partnership reflected in Minister Rocella's correspondence, and we value the Council of Europe's continued engagement. The Rome Conference of 2024 marked a milestone in recognizing health literacy as a shared instrument to advance human rights and combating discrimination, an approach we strongly endorse. The principles at the heart of this initiative resonate deeply with us. As highlighted in the draft statement of intention, health literacy is a cornerstone of democratic resilience, a vital bridge between institutions and people, and a prerequisite for the effective exercise of the right to health. It strengthens trust, empowers individuals and communities, and ensures that no person or group is excluded from meaningful participation. In Albania, these values guide our reforms within the European Union integration framework and our national health strategy. Our objective is clear: to ensure that every individual can understand, use, and trust the health information and services available to them. We firmly believe that health literacy is a shared responsibility requiring coordinated action among governments, professionals, civil society, educators, and communities. The Rome Coalition offers precisely the structured collaborative platform that it is needed to advance equity, inclusion, and human dignity across Europe. I wish you a productive and inspiring discussion. Please accept once again my heartfelt apologies and the warmest greetings from Albania. We remain fully committed to contribute to this collective endeavor. Thank you.
Ringraziamo la Ministra e la Viceministra dell'Albania, Ministra della Salute e degli Affari Sociali, appunto per il contributo, ma anche per il supporto a questa iniziativa. Ora passo la parola a Vasiliki Karauli, segretario permanente del Ministero della Coesione Sociale e della Famiglia della Grecia. La invito a raggiungere il podio per il suo speech. Grazie, grazie.
So, good morning, Excellencies, distinguished ministers, dear colleagues. It is an honor for me and a privilege to be here today in this very important meeting. And first of all, I would like to address the message of our Minister of Social Cohesion and Family Affairs of Greece, Maria Domna Michailidou. On behalf of our Minister, I am honored to extend her warm wishes and greetings to all distinguished participants of the conference. The Minister, yes. Thank you very much. The Minister conveys her deep appreciation for the commitment to advancing health literacy, strengthening human rights protections, and promote people-centered systems across Europe and beyond. She emphasizes the importance of listening to people's real needs, empowering communities, and building trust across all institutions. She reaffirms also Greece's dedication to collaborative actions and expresses her confidence that our work today in this conference will contribute to more inclusive, equitable, and resilient societies. And for my part now, for me it is also a great honor to address this high-level meeting in a theme that captures a fundamental truth, that health systems function effectively Only when people understand them, trust them, and feel empowered to participate in decisions that shape their health and their future. As it is affirmed by the World Health Organization, health literacy encompasses the skills, knowledge, and motivation that allow people to access, understand, appraise, and apply health information. Within a human rights framework, health literacy is strongly connected to four fundamental principles: the right to accessible information, the right to meaningful participation, the right of non-discrimination, and the right to protection from harm. Inadequate health literacy does not simply reflect an educational gap. It is also a structural barrier to autonomy with direct implications for equity and justice. When individuals are unable to comprehend medical advices or navigate a healthcare system, our health systems do not respect the human diversity. The theme of today's meeting, listening and empowering people to build trust, reflect also a fundamental truth, that health literacy cannot be strengthened through one-directional communication. We need, and it requires, dialogue, cultural sensitivity, and institutional humility. A right-based approach demands that we listen to diverse population needs, we adapt services accordingly, we produce information and health policies, and you ensure transparency and clarity in all public health messages. By embedding listening into policy and practice, we are oriented to a model of shared responsibility and mutual respect, thereby strengthening democratic legitimacy. We know that we are in an era defined by rapid digital transformation, increasing social complexity and global public health challenges. And here the trust has become one of the most essential public goods. Yet trust cannot be legislated. Trust must be earned, nurtured, and sustained through transparency, respect, and empowerment. Trust influences vaccination uptake, for example, adherence to treatment, use of preventive services, and engagement with digital health tools. But trust flourishes only when people feel heard, respected, and valued. We can mention 4 elements or 4 mechanisms through which health literacy strengthens trust, and that are clarity, consistency, participation, and protection. Thus, investing in health literacy is not simply a public health strategy as it was seen perhaps before. It is an investment in resilient institutions and social stability. And I agree also with the minister that for me also empowerment is a very important key word. It is a modern word for all the people, I think, in every occasion. For example, for us public servants, it is a new tendency, empowerment, instead of the real fear of not to be obliged to do our duties. So all people have to be empowered to do their work and also to advocate for their rights. Empowerment is both a principle and a process. It is a bridge between listening and trust building. Empowerment in the context of health literacy means enabling individuals to access understandable information, evaluate risks and options, ask informed questions, participate confidently in medical decisions, navigate the healthcare system, and advocate for their rights. Some key methods to empower people, because I was also wondering how we can achieve this goal to empower people. It is not easy. So I can propose some key methods, but that are not the only one. So some key methods to empower people are plain language and clear communication standards, teach back and share decision-making protocols. So we know that training clinicians to confirm understanding by asking patients to repeat information in their own words, that can help to have a health literacy, a better health literacy. Culturally and linguistically appropriate services, digital inclusion strategies, community health mediation and peer navigators, co-design of health policies and services, involving citizens in the design of public health campaign, for example, and health literacy education across the lifespan. Although each national system faces unique challenges, the European Union and the Council of Europe share common goals, like reducing health inequalities, enhancing inclusion, strengthening democratic governance, and safeguarding rights during digital transformation. And here I would like to mention also some data for the Greek situation. Evidence from European surveys indicates that also for us, nearly half of adults in Greece experience inadequate or problematic health literacy. And like several European countries, Greece also reports elevated levels of unmet healthcare needs, particularly among vulnerable populations, again underscoring the intersection between literacy, accessibility, and equity. Some policy priorities that we can propose can be clear communication standards, workforce development, digital inclusion and equity, community-level empowerment, for example, by strengthening long health promotion structures, and governance, accountability, and rights monitoring. And for the end, a vision for the future, we can say that will be advancing health literacy is not simply a health sector reform. It is also, or it means also democratic participation, human dignity, public trust, and sustainable development. Health systems that listen, communicate clearly, and empower people are health systems that are more resilient, more equitable, and more capable of responding to the complex challenges of our time. In building trust, we build healthier societies. In empowering people, we uphold human rights. And in strengthening health literacy, that all we need. So we reinforce the foundation of social cohesion across Europe. Thank you very much indeed.
Grazie. Grazie al segretario permanente Vasiliki Karaouli della Grecia per il contributo molto sostanzioso che ha dato e per aver sottolineato tra i tanti concetti il concetto della fiducia e quello di empowerment. Allora, adesso passerei la parola a Lorenzo Montrasio, che ringrazio appunto per la collaborazione e il contributo, insomma, a tutto questo percorso che abbiamo costruito, per delle diciamo considerazioni di sintesi della mattinata.
Grazie Agnese per questa introduzione, non vi nascondo che sono veramente onorato di essere qui e veramente grato per la possibilità di aver costruito questo evento alla sua terza edizione in un modo così importante, così partecipativo. In questo senso voglio ringraziare veramente la Ministra Eugenia Roccella per la profonda volontà di portare avanti questo percorso e aver creduto così in modo così importante nell'importanza di questa tematica, così come anche il Ministro Schillaci, che ci ha ricordato moltissimi aspetti importanti e le implicazioni che l'alfabetizzazione ha quando si tratta di mantenere un sistema sanitario resiliente. Grazie al direttore Benitez per la sua partecipazione, per aver portato la prospettiva del Consiglio d'Europa in questo consenso e per il percorso costruito insieme. E altrettanto un grande ringraziamento per la partecipazione anche da distanza della Vice Ministra dell'Albania, del Segretario Permanente della Grecia e sicuramente all'UNAR, al suo direttore Mattia Paradotto, che senza il cui sforzo e impegno credo che non potremmo veramente essere arrivati a questo punto. Quindi davvero grazie. E professoressa Morresi, inutile dire l'importanza del suo contributo e anche di aver costruito, e anche ricordare che lei è stata colei che ha guidato il percorso della guida sull'alfabetizzazione sanitaria del Consiglio d'Europa. Quindi
Sì,
grazie davvero.
Ti interrompo in maniera rituale per ricordare i due Kristin Sorensen e Lee Ibard, adesso eccoli, con cui insomma io da Kristin, che ascolteremo oggi pomeriggio, mi ha insegnato tutto sull'health literacy e lei è stata veramente il nostro punto di riferimento, e lì è stato il nostro pilastro proprio dentro il CD Bio, quindi irritualmente scusa l'interruzione, ma ci tengo a ricordarlo perché senza di loro la guida non ci sarebbe stata.
Allora, come messaggi chiave per chiudere questa sessione della mattinata, io credo che alcuni elementi siano veramente importanti. Uno è quello legato alla trasversalità dell'azione che è necessaria per affrontare l'alfabetizzazione sanitaria. L'alfabetizzazione sanitaria riguarda aspetti della salute e aspetti dei diritti individuali. E in questo senso è importante che ci sia un'azione trasversale delle istituzioni e dei rappresentanti della società civile. Molto importante il fatto che è stato ricordato che questo non è un percorso che nasce oggi, che ha una prospettiva futura, e molto importante è stato anche ricordare che esistono degli strumenti del Consiglio d'Europa che già oggi tutelano il diritto alla salute. Parole chiave, ne abbiamo sentite tantissime, credo che fiducia, strettamente connessa a diritti, sia un aspetto molto importante perché richiama la necessità della fiducia nelle conoscenze scientifiche, nelle istituzioni, nei processi che mirano a responsabilizzare le persone e a proteggere i valori democratici, come giustamente richiama il sottotitolo di questa nostra conferenza. Infine, un messaggio credo più importante è aver ribadito un impegno a costruire una coalizione, la coalizione di Roma, sull'alfabetizzazione sanitaria e i diritti umani, e l'invito al Consiglio d'Europa a coordinare e a muovere azioni in questa direzione, che è stato accolto, e in questo ringrazio ancora il direttore Benitez. Egregie autorità presenti in sala, distinti ospiti. Nel chiudere i lavori di questa mattinata io vorrei ricordare che nel pomeriggio i nostri lavori continueranno. Avremo una prima sessione che illustrerà le prospettive di ricerca necessarie per approfondire questa tematica e quindi aiutare a costruire delle politiche realmente connesse con la società e coi bisogni. Avremo una seconda sessione in cui verranno presentati degli esempi pratici di cosa sta succedendo nei diversi paesi, estremamente importante. E in questo senso vorrei veramente ringraziare tutti i rappresentanti istituzionali che sono presenti in questa sala, sia i paesi che hanno già iniziato un percorso negli anni passati, ma anche per i paesi che hanno dimostrato un grande interesse a partecipare a questo nostro evento, e in particolare l'Albania, la Grecia, l'Italia, la Lettonia, il Portogallo, San Marino, la Svizzera e la Turchia. Con quest'ultimo ringraziamento non posso che concludere questa sessione della mattina, invitarvi al pranzo e augurare a tutti un buon proseguimento dei lavori nel pomeriggio. Grazie.
Miguel. Welcome back to everybody. Take your seats. Okay, welcome back. I hope you had a good lunch. Thank you very much to our Italian hosts and friends for the lunch. Thank you so much. First of all, thank you to you know who you are. We have a very short session of 20 minutes, and we're already past the 2 o'clock. So I'll be very short by saying welcome back. Welcome to everybody online. We're trying to keep the time, so welcome for those watching us. My name is Lee Hibbard. I'm from the Health Division of the Council of Europe. And with me, we've changed perspective from the morning. We have different perspectives at the table. We have Guglielmo Bonaccorsi and Chiara Lorini, who are both professors of public health at the University of Florence. Welcome to you both. We have Christine Sorensen, who, if I can say, a thought leader, and from the Global Health Literacy Academy in Denmark. And we have a short session to, Christine, Guglielmo, Chiara, we've been on a journey together for the last 3 years. Huh? This is a bit of a journey, and it's culminating in different thoughts and ways forward. And your perspectives are a little bit different. And so we're here to talk about your different perspectives. But just very briefly, going back to the beginning, we had this guide to health literacy in which we constructed with Suntan, with many other colleagues, which was the cradle for the work for the first conference. And in that first conference in the end of 2023, I took away that many people were lonely, that they were living in solitude, that there was a problem of inclusion of those people and others in society, and that there was an issue of well-being generally, well-being regarding their health. And then we moved to the second conference at the end of 2024. And what I learned from the work of Christine and Guglielmo and Chiara was that there were lots of people and groups in society who had low levels of literacy, who were hard to reach, who were not necessarily in the mainstream of information flows and able to access services. And we saw the problems, the fallout from discussions this morning. And I would go further by saying that they prepared 2 very good reports from the last year, which are very useful for your context, for your thinking, which are on the webpage. Have a look at them. But just to say that when I reread your report, Guglielmo and Chiara, I came back to words of community, to communicate, to barriers and the need to dismantle barriers, to manipulation of thought, of information, and also to co-creation. Need to co-create things for the future. And we've heard those words today, this morning, and now we find ourselves here for this third conference and for this session, which we don't say enough of the subtitle of this conference, which is listening and empowering people to build trust. Listening and empowering people to build trust. And that means to me, that means agency for me, that means dignity, that means autonomy, you've mentioned that, and of course inclusion. That's why we bring together, we don't just talk about health literacy now, we talk about health literacy and human rights together, because they are bound together. And this is where we find ourselves. So I'd like to invite first of all, Christine to come and say a few words and to give her reflections. What have we learned over these last years? How should governments act in the future? Well, how can we support governments in moving forward? Christine.
Thank you very much. And friends and colleagues, it's such a pleasure to be back in Rome, and especially to hear the great news of this morning that we will have an alliance on health literacy and human rights, the Rome Coalition. But let me start with a little story. So imagine a dandelion pushing its way through a crack in a concrete road. It survives, it's stubborn, resilient, and determined, despite the harsh surroundings. But when that same dandelion lands in a nurtured field with rich soil and open space, it doesn't just survive, it flourishes. And you can clearly see the difference on these 2 flowers here. So it reminds us that while strength can emerge even in tough conditions, true growth happens when the environment supports it. And this is really what health literacy is about. Health literacy, the ability for people to find, understand, appraise, and apply information, has become one of the most decisive factors shaping health, equity, and resilience in Europe today. And although that right to health is protected, as we heard this morning, across our region, millions still cannot fully exercise this right simply because they cannot navigate the complexity of our health and social systems. And the result is predictable and preventable: deep inequalities, avoidable suffering, and rising societal costs. So, in my view, health literacy and human rights is really overdue, and we need to look at it as an investment, as a powerful win-win for Europe, where we empower the individuals and strengthening the systems that serve them. And allow me then to present how such a strategy could look like. And I know it's very small here, but you will get the idea of why this matters. The one column is the vision, or the top setting here is the vision and the mission and outcomes we want to achieve, and then examples for how Council of Europe can proceed, but also how governments can proceed. Because health literacy matters. Health literacy is foundational. It enables people to prevent disease, manage chronic conditions, understand entitlements, and participate meaningfully in decisions that affect their lives. And it's also, at the same time, we will have societies with higher health literacy that enjoy better health outcomes, greater trust, fewer inequalities, and more efficient services, and not least, stronger democratic participation. So this is the essence of the win-win strategy, that people are knowledgeable, that systems become more effective. And when systems communicate clearly, people gain agency and everyone benefits. So it's a challenge we need to confront. And as Lee said, we saw last year, we discussed how at least 17 different groups in vulnerable situations were accumulating the burden of health literacy, including older persons, migrants, persons with disabilities, minorities, people with low income and education, and those who are homeless or chronically ill. And so these groups particularly face profound barriers, fragmented services, limited culture and linguistically resources, and exclusion. So we need to bridge the gap of the rights and on paper and rights in practice. And this is where governments and the Council of Europe can play a role. So the good news is that health literacy provides this clear win-win strategy. First of all, it can be a rights-based policy integration. Health literacy must be embedded as a human rights priority in national health strategies, supported by clear legal frameworks and accountability mechanisms. When rights and responsibilities are aligned, systems become fairer and more coherent. And we already have examples of countries that have health literacy strategies like Portugal, Norway, Slovenia, Germany, and others. So this is one of the examples that is included in this strategy. Secondly, we need to support those most at risk. Disaggregated data must guide our priorities. We have the MPOL survey that some of you are involved in, which measure population health literacy and organizational health literacy in European countries. We have the evidence. Now it's about turning it to action and to co-design solutions with those communities to build trust and relevance and uptake. And so thirdly, organizational health literacy, where rights must be enacted where people seek care. And it means that organizations, institutions, hospitals, clinics, social services, all kinds of organizations, even private industry and civic society organizations can help make it easier to access health. Fourth, coordinated cross-sectoral action. This is not a health issue alone. It goes across the whole board of ministries. So it's a whole of government approach. We need a whole of society that we need, but it takes champions to connect those dots. So governments are the linchpin here. You can mainstream health literacy across policies, allocate resources, and cultural appropriate community-driven interventions. But it needs also the resources to invest in the capacity building for professionals and community leaders. And I'm happy to see how over the 3 years we have seen the growth of mainstreaming health literacy and human rights into the language, thanks to those conferences here. We need to leave no one behind, so let me finish here with a call to actions. It's not a technical exercise. This is a human rights effort. It's about dignity, justice, and human rights, and that's what I mean with the win-win strategy. So let me thank the Italian government, the Italian representation in the Council of Europe with Assunta, and UNAR, not least, and our Italian research colleagues here, because you have bravely raised to the occasion, and not only once, not twice, but 3 times you've been, pushing and opening the door. And this series of conferences has truly led now to results. So next year, I'm sure we will see this new strong alliance. I hope we will engage the new generations. It could be in a roundtable, in a summer school, in a summit. We already heard dedication from Council of Europe that we can include it into different meetings. So working with the decision makers and the whole span of all generations here will be important to shape a more health literate future. Thank you very much.
So let's go straight to our colleagues, Guglielmo and Chiara. The scope is wide, it's massive. There are a number of levels. You mentioned it in your report. It's very, very ambitious. It's quite, I have almost vertigo. How do we cope with that, and how do we do it in the future? How do we affect real change? Please.
Grazie Lee. Comincio in italiano e poi switch in English perché voglio ringraziare sentitamente tutte le autorità, in particolare Assunta, Lorenzo, Mattia, che ci hanno consentito la partecipazione per il 3º anno consecutivo. Quindi ci credono, direi, non quanto noi, ma forse più di noi, per cui siamo molto contenti di questo e finalmente credo che l'alfabetizzazione sanitaria anche in Italia stia trovando la propria collocazione, la propria dimensione, soprattutto in una prospettiva di protezione dei diritti umani e tra questi naturalmente il diritto alla salute. I switch in English. Esteemed authorities, colleagues, ladies and gentlemen, in the field of health and in defense and protection of health as a fundamental human right, the role of researchers and more in general of academia within a coalition for health literacy, from now on the Coalition of Rome, is among other potential objectives to contribute to building a physical environment. Introducing and acting health literacy means creating healthcare and also other social environments that facilitate understanding, reduce uncertainty, and support informed decisions. It also means recognizing that the quality of communication is not an individual responsibility, or at least not only an individual responsibility, but a structural attribute of the organizations and the systems. And in this perspective, health literacy can contribute to build virtual bridges. The first bridge, a bridge between science and policy. That is to find a common ground to translate scientific evidence-based interventions for policymakers. And the second one, a bridge between research and action, meeting the translation of discoveries referred to health literacy into practice for organizations operating on the ground. The third bridge is a bridge between higher and lower health literate people, as Christine said before, especially for vulnerable groups, and moreover, higher and lower health literacy organizations. And this is not only an ethical value. No one must left behind in a democratic society and in a democratic country, but also an economic convenience, because whenever a community is able to protect itself from health threats and can find the best answers for the majority of its members, the expected result in terms of health, human rights protection, appropriate and cost-effective solution for everyone can be significant for both citizens and governmental authorities. And the economic savings generated can be and perhaps must be reinvested in further public services for people's health protection, prevention, and promotion. And finally, a bridge between different stakeholders of modern society with a keen interest in developing health literacy for themselves and for the people within their sphere of responsibility. that is professionals in healthcare, but also in social sectors and educational sectors, and also caregivers and actors of civil society, for example, NGOs, citizens' representatives, and moreover. Alongside the creation of bridges, health literacy is able and has the power to dismantle barriers, as Lee said before. And in this sense, too, the role of researchers and academia is fundamental because we can act as sentinels, identifying and reporting obstacles to those having the power to decide, governmental authorities, but also regional and local authorities. And we can dismantle barriers to accessing essential services, but also barriers to the adoption of healthy behaviors, for example, diet, physical activity, avoidance of substance abuse, and all the commercial determinants of health. And finally, barriers to reliable information able to counteract misinformation and disinformation, where fact-checking from authoritative scientific sources can become crucial to avoid denialist and harmful behaviors. In so doing, official channel of communication, those endorsed by governmental authorities, could regain the necessary prestige and credibility. So my final conclusion is that current trends suggest an increase in information complexity and a greater dependence on digital systems. And the generative AI, artificial intelligence, and Lee is an expert in this field, will further accelerate the production of healthcare content, increasing the need for critical skills to distinguish reliable information from persuasive or misleading narratives. If health systems do not adopt a structural education model, with at the center health literacy, of course, information fragmentation and digital vulnerability will tend to amplify. Conversely, integrating health literacy as an organizational infrastructure will allow for the construction of more readable, equitable, and resilient services geared toward people's participation and autonomy. Thank you for your attention.
Please, Chiara.
Thank you very much, Lee, for the presentation. For me, it's a big honor and a big pleasure to be here for the first time, so thank you so much. And thank you for trusting health literacy. I will try to be practical by suggesting concrete actions and ideas. In my opinion, the main aim of the Coalition of Health Literacy and Human Rights should be to facilitate the development of health literacy among vulnerable groups. To achieve this goal, two approaches can be identified. In fact, health literacy is now seen as the balance between individual abilities to access, understand, and praise and apply health-related information and the complexity of the health information environment. From this perspective, health literacy can be improved either by enhancing individual abilities or by simplifying the information system. Individual abilities can be strengthened by education. Educational settings play a crucial role in promoting human rights by improving health literacy, ensuring that individuals are equipped to make informed health decisions, advocate for their rights, and contribute to healthier and more equitable societies. Moreover, since health literacy and the other life skills could be developed also during all the life course, lifelong learning is crucial in order to continually realign knowledge and skills with the demands of a rapidly changing world. Think about information technology and artificial intelligence, for example. With regard to the health information system, strong efforts are needed to improve accessibility to high-quality information, as well as to make messages simpler to understand. For vulnerable groups, both aspects are extremely relevant, also because many communication channels and messages are designed around the so-called average user, an adult, a man with a medium level of education, fluent in the local language, in good health, so without particular limitation regarding physical or cognitive abilities, and employed so with sufficient resources in terms of economic availability. In order for messages to effectively reach vulnerable groups, a key element is the co-design of communication strategies. The only effective way to ensure that messages are understood is the direct inclusion of the target population in their formulation. From this perspective, partnerships among all stakeholders become essential, including patient associations, NGOs, scientific societies, and of course, local communities. In conclusion, I would say that health literacy is not something that can be improved by isolated projects alone. A realistic and effective scope of action must operate simultaneously on 3 different levels: the systems, the organizations, and the individuals. This meaning integrating health literacy into health policies, education, social services, and digital strategies. 3 priorities areas are, in my opinion, particularly urgent. Navigation on health systems, health communication, and digital health literacy. Finally, no one of these is possible without partnerships. In my opinion, this coalition represents an extraordinary opportunity to align policy, practice, and participation, to turn health literacy from a technical concept into a driver of equity and justice, and finally, to make the right to health not only a legal principle, but a lived reality. Thank you.
Okay. So just to say, well, thank you so much for your thoughts, for curating your research perspective, your view, which is different to others' perspectives, and I really appreciate that. We will take this back and build it into the future, I hope, very much, first of all. But I would just say, I'd like to just come back very quickly before we change panels to the Guide to Health Literacy, which is a document which is outside. It took 2 years or so, Assunta, 2 years. So it took 2 years of thinking and writing and preparation. It's all here. So please have a read. But I would just very quickly reiterate the 5 operational actions which only work with health literacy. Access to valid health information. Access to appropriate care with health literacy. You've said it. Communication between individuals, health professionals, and health authorities. Shared decision-making regarding treatments and care. Access to digital spaces to understand and use health services. But of course, what we learned today, it's cross-sectoral. It goes beyond the healthcare service systems. It's also outside people who are not patients yet, for example. So I just wanted to bring us back to the cradle, which is written down too. It's very important. And there are a lot of good practices from different countries, from Italy, from Turkey, from many other countries too. And it's a living document. So thank you for your time. It's a very short session, so I apologize, 20 minutes or so. Thank you, and let's move to the next panel. I'm looking for Miguel. Miguel, please. Thank you. Miguel, sorry.
I think that we can go ahead. Yeah. Thank you. Thank you. So thank you very much. Having everyone set up, I would say that I'm really privileged to coming back again and for the 3rd time. So my name is Miguel Telderriaga. I'm the Director of the Disease Prevention and Health Promotion within the Portuguese Directorate General of Health. And it's my big privilege to be here in a different role today. So we usually also explain and share our good practices, and I'll try to move up to my moderated work and not feeling the will to be sharing also some of our experiences that we are leading up in Portugal and in the Portuguese reality. So let me tell you that it's a very, very great privilege for me to be like moderating this session, and I will try to explain you how we are planning to work. So it's probably the longest session that we will have, and I believe that we'll have the opportunity not only to hear like the brilliant presentations from the colleagues, but then and as well to have some part for discussion, to have some questions, and I will start from there. Let me start to introduce all the colleagues that we have. So on my right, Luisa Borgia from the National Bioethics Committee of San Marino, then Robert Gadja from the Commission for Protection for Discrimination from Albania, then Tigran Karaptian, I'm sorry Tigran if I misread your, your name, from the Council of Europe, then Signy Mezinska from the Steering Committee for Human Rights in the field of biomedicine and health at the Council of Europe from Latvia, and then Luciana Teofili from the National Blood Center from Italy. So thank you so much. It's really a privilege for me to be here. This session will be discussion about listening and empowering people to build trust with institutional perspectives. So Chiara, Christine, and Guillermo already set the scene with the help of Lee, and I believe that we can move from there. So we know about the importance, the conceptual importance about all of these approaches. How can we move from then the theoretical, from university perspective, to the bodies of the government, and how can we in fact listen to people? How can we promote trust? There's a big amount of challenges, but I believe that the presentations from my colleagues will set the scene and will help us out then for further discussion. So with no further ado, I will give the floor now to Luisa, and then moving from more to the other colleagues, and then we will start our discussion and our questions. So thank you so much.
Grazie, parlerò in italiano. Ecco, adesso si sente, grazie. Allora, intanto è un privilegio essere stata invitata qui a portare la voce di San Marino che rappresento, ma vorrei congratularmi con gli organizzatori per aver dato voce in questa sessione alle istituzioni, agli organismi. Quindi grazie, perché potremo cercare di dare un esempio, parlare di esempi concreti, ed è quello che andrò a fare, cercando di dare due prospettive, due esempi. Allora, io sono il presidente del Comitato Nazionale di Bioetica di San Marino, la piccola ma più antica repubblica del mondo, e volevo spiegarvi come il nostro comitato è diventato un ponte tra la cittadinanza e il governo. Quando nell'ottobre 2023 abbiamo licenziato il documento sul diritto all'oblio oncologico, proprio mentre l'Italia stava varando la legge, e quindi inserendoci nel piano europeo di lotta contro il cancro, nel programma EU for Health, eccetera. Nel momento in cui abbiamo varato questo documento e ne abbiamo dato notizia, abbiamo visto una risposta da parte della cittadinanza probabilmente che non ci aspettavamo, ossia i cittadini di San Marino sono stati talmente coinvolti in questa e colpiti da questo documento che hanno avuto una consapevolezza di quanto lo strumento dell'oblio oncologico potesse incidere sul raggiungimento dei propri diritti, che non era soltanto il diritto alla salute, ma diritto al lavoro, il diritto ad avere accesso a finanziamenti pubblici per comprare una casa, creare una famiglia, il diritto di poter accedere alla possibilità di avere l'adozione di un figlio, eccetera, eccetera, eccetera. Ed è stato talmente coinvolgente che le associazioni delle persone, dei malati oncologici, hanno scritto una legge di iniziativa popolare, presentata poi al Parlamento di San Marino, che in quell'occasione, stranamente per tutti i parlamenti, non soltanto per San Marino, ha trovato una uniformità di vedute e una unanimità per cui hanno deciso di bypassare tutti gli step burocratici e di adottare una procedura d'urgenza, per cui quella legge è stata varata nel dicembre 2024, quindi esattamente un anno dopo il nostro documento, all'unanimità.
ed è stata una cosa incredibilmente positiva che volevo portare alla vostra attenzione, proprio perché la gente è diventata consapevole di quanto lo strumento lanciato dal comitato poteva comunque andare a mitigare le disuguaglianze e le discriminazioni. Quindi questo è un esempio di buona pratica. E così la bioetica finalmente è diventata concreta, no? Ma volevo invece portarvi un'altra prospettiva, cioè che cosa c'è ancora da fare? Tanto, ovviamente, ma io ho individuato in particolare un vuoto che dovremmo colmare in linea con l'attività del nostro comitato, che ha sempre avuto un fil rouge, che è quello delle persone con disabilità, visto che nel 2013 siamo stati il primo comitato che ha scritto un documento proprio sull'approccio bioetico alle persone con disabilità, e in ogni nostro documento dedichiamo un capitolo a questo, declinando appunto tutti gli argomenti. Dunque, non immaginiamo che la health literacy sia rivolta esclusivamente ai cittadini come fruitori, perché c'è un altro target, e cioè di coloro che invece sono i professionisti sanitari, che hanno la stessa necessità di avere health literacy tanto quanto i pazienti e i cittadini. Perché dico questo? Ora, se io vi chiedessi quali secondo voi possono essere gli ostacoli che impediscono l'inclusione nell'ambito della salute delle persone con disabilità, probabilmente voi mi rispondereste immediatamente: ma un difficile accesso fisico, per esempio, ai servizi sanitari spesso ubicati in assenza di facilitazioni, pieni di barriere, oppure servizi e dispositivi diagnostici pensati e costruiti senza tener conto delle esigenze delle persone con disabilità. Per esempio, provate a fare una risonanza con una persona in sedia a rotelle, cioè non pensati per quelle persone. Benissimo, tutto vero, ma c'è ancora un'altra barriera meno nota o meno evidente, e che è quella a monte che impedisce un equo accesso alla salute, cioè la formazione curriculare dei professionisti sanitari, per i quali non è prevista una specifica formazione nel trattare le persone con disabilità fisica o mentale, non solo in ambito terapeutico, ma anche in ambito di comunicazione con queste persone. Per cui, in caso di necessità di terapie, farmaci e assistenza specializzata, i bisogni devono essere adattati alle esigenze specifiche e alle interazioni con la disabilità preesistente. E siccome ho promesso di fare degli esempi concreti, vi faccio un esempio concreto. Allora, mettiamo che una persona affetta da distrofia muscolare abbia bisogno di un intervento. Bene, abbiamo l'equipe, abbiamo l'anestesista, ma non tutti i professionisti sanitari, in questo caso cito gli anestesisti, se c'è qualche anestesista non me ne voglia, non tutti possono essere trattati, soprattutto queste particolari persone, con un protocollo standard per la somministrazione dell'anestesia, perché richiede un team con specifica formazione, specifici protocolli, perché la rutinaria anestesia su tali persone potrebbe aumentare i rischi cardiaci, respiratori, sensibilità ai farmaci anestetici, possibilità di reazioni gravi. Pertanto l'approccio anestesiologico per tali persone richiede una gestione specifica, attenta, un monitoraggio rigoroso, la considerazione di altre opzioni come l'anestesia loco-regionale, se appropriato, eccetera. Quindi richiede la conoscenza di interventi che esulano dai protocolli standard che normalmente vengono insegnati ai nostri professionisti sanitari. Così come in ambito comunicativo potrei fare esempio, per esempio, degli odontoiatri. No? Gli odontoiatri sappiamo che sono formati ad approcciare i minori, i bambini. E vi chiedo, sono ugualmente formati ad approcciare le persone con disabilità, soprattutto quella mentale? Altrimenti, in caso contrario, vi è un mancato accesso di tali persone alle terapie odontoiatriche e quindi noi impediamo un equo accesso alla salute. Non perché loro non vogliano, ma perché i professionisti sanitari non sono in grado di darglielo. Quindi parliamo quindi di persone con vulnerabilità che rischiano di essere escluse dall'accesso alla salute. Ecco, in questi ultimi esempi che vi ho voluto dare siamo di fronte ad un ribaltamento dei destinatari della health literacy, quindi non più la prospettiva dei pazienti, ma la prospettiva dei professionisti sanitari, per i quali il sistema formativo deve ripensare i contenuti affinché i professionisti, ciascuno nel proprio campo, possano essere in grado di modellare protocolli diagnostici e terapeutici sulle caratteristiche delle persone con maggiore complessità, oltre che vulnerabilità. Ecco le mie due situazioni concrete. Una possiamo dire positiva, quindi di good practice. L'altra che presenta ancora grosse lacune, per ribadire con forza che parlare di health literacy è una questione che va oltre lo specifico diritto alla salute, ma investe il più ampio e complesso contesto di diritti umani, e solo attraverso una sinergia intranazionale e internazionale possiamo giungere a un'alfabetizzazione di tutti gli attori coinvolti, platea ben più ampia dei cittadini intesi come pazienti. All'interno dei singoli paesi importante è la sinergia, la cooperazione tra organismi, come nel caso di San Marino. Voi potreste dire, beh, grazie, parli facile, è un piccolo paese, hai più facilità. Sì, però, voglio dire, se riuscissimo, no, ad avere incisività anche negli altri grandi paesi, a fare da ponte con i decisori politici, sarebbe un bell'obiettivo, e anche in ambito internazionale sulla programmazione di azioni comuni. Questi sono gli obiettivi, penso, di un piano strategico ed è razionale alla base della nascita di questa coalizione, che ci vede convintamente partecipi e pronti a lavorare su azioni specifiche sulla base delle nostre peculiarità. Grazie.
Let me just thank Luisa for two things. First of all, for the brilliant presentation, and let me highlight the importance of the training of the professionals. I believe that this is something that we have been talking about, goes along with diagnoses that were also made by the colleagues. And then in a personal perspective, that was my biggest proof that I can in fact understand Italian, even though people speak really fast. So thank you so much. It was great. Thank you so much. So now again, moving the word
Time
to...
run.
No, you skip your 8 minutes. We were having a kind of a joke together. Okay, so Robert, now the floor is yours. Thank you so much. Yeah.
Grazie.
Okay.
Well, dear participants, first of all, I want to thank Mr. Peradotto and Mr. Montrasio on inviting me here in this important event. Secondly, I will be sincere in saying that I know little on this initiative and effort related to health literacy, but I understand the importance of it and also of creating a coalition for a joint collaboration between countries. This is why the role of Council of Europe is crucial in this regard. Thirdly, it is of importance also to translate this guide in all the languages of Council of Europe members, which can help the local institutions for a better understanding of the importance of health literacy. Now, I want to spend some words on explaining the role of the institution, not so much, and then from some concrete perspectives explaining what is the role of the institution on health issues. Now, as main competencies of the Commissioner for Protection from Discrimination in Albania is to inform and raise awareness on the rights and the potential of the institution, conduct of monitorings, analysis, and studies, to understand the trends of discrimination, to give opinions in the drafting phase of laws and bylaws, to participate in courts, also the main competence is to handle concrete complaints from individuals, group of individuals, civil society organizations, and concluding investigations with binding decisions, which should be implemented. In this case, the nature of the equality body is of quasi-judicial, but also the commissioner can start ex officio cases and issue recommendations, mostly with the scope to address structured and systemic discrimination. Now, according to this experience and to these competencies that we have, and the concrete cases that we have handled as institution, I can mention some of them. Some of the cases, or a very good part of those cases, is related to lack of medicines for different categories of diseases affecting people with disabilities and children, but also related to the economic status of these people. Therefore, in these cases, the discrimination has been intersectional. Another problem is lack of accessibility for persons with disabilities in healthcare centers distributed throughout the territory, differentiation in treatment for LGBTI and Roma people, lack of means of communication and access to information for persons with disabilities, especially people with impairment in hearing, blind people, but also with mental disabilities. Now, I'm glad to see, for example, in this event, you have provided interpreters in sign language. And also lack of information and means of communication due to language barriers, especially for foreigners, immigrants, and or asylum seekers. Now, what we have seen as structural and systemic problems identified during the work, especially in relation to patients, the following can be noted. Lack of continuous and accessible information, especially for disadvantaged and vulnerable groups. Non-collaboration, non-cooperation, and non-coordination of various health institutions to solve various problems, for example, as the case of the medicines, of providing medicines. Lack of effective planning and administration of services, means, human resources, budgets, institutional organization, which most often falls negatively into the categories of vulnerable groups and disadvantaged groups. And in some cases, lack of proper sensitivity and empathy has been exposed, resulting in inhumane treatments. Now, some of the suggestions that I have on this regard is that first, that should be guaranteed physical and information accessibility for all different categories of persons with disabilities in all institutions that provide health services. Dedicated information campaigns for Roma women and children, women in rural areas, persons with disabilities, children and young people in simplified and understandable formats, for example, on hygiene, prevention and patient rights. For example, during COVID-19, we have had different problems, especially for people with impairment in hearings, to have the proper information how to deal with the pandemic. Now, and I'm glad that we have the same thought, trainings with staff of doctors, nurses, and health personnel on avoiding direct discriminatory behaviors toward patients coming from vulnerable groups, but also on human rights for categories that have been ignored until now, such as, for example, intersex people. We do have a lot of problems in our health system to understand and then to provide and to guarantee their human rights. And in this regard, I think that there should be closer cooperation with human rights institutions and equality bodies. Also, effective cooperation and collaboration between different health agencies to guarantee the quality and quantity of different services with special attention to vulnerable groups, and also building periodical and real platforms of communication with CSOs in protection of vulnerable groups and groups of patients for a better understanding of their needs and specificities to address systemic and structural discrimination. Now, two other suggestions that I have is that, first of all, I think that in this coalition, national human rights institutions should be part of this coalition, because I think that they can contribute also from their knowledge, but also in pushing the authorities for health literacy. And also, I would invite this coalition to collaborate with ECRI, which is the European Commission Against Racism and Intolerance, because in these years, they are going to do a general policy recommendation on health systems and discrimination on health systems. So I think the collaboration of this coalition with ECRI in this regard can be very productive. But I wanted to conclude with two questions that I had during this situation. Now, as you see, the guarantee of health protection in countries which are part of Council of Europe is very different. Now, as I saw it, one of the objectives of health literacy is to build trust between patients and health system. But how can you build trust through health literacy and then not providing the health protection? And as you saw, we do have different problems than in the services that should be provided to people. So we can do a good campaign in health literacy, but then in the end, we should provide the services, because how can we build trust? And the other one is that now that we are in a time of using digital means that can be very useful on informing, but there can be very dangerous on disinforming. And especially we know that young people they use a lot this means, but not in a proper way. Now, how is it seen in this guide, or how is what can be the thought in a different moment to deal with the disinformation that is provided and to address people to get information from proper institutions and in the proper way of this health literacy, and not being endangered by disinformation, which happens a lot, especially on health and services provided and every information related to health. Thank you very much for this opportunity, and I'm looking forward to collaborate together and to invite other equality bodies to be part of the coalition in their countries and also in collaboration with the Council of Europe. Thank you.
Thank you. Thank you so much. Thank you very much, Robert, for the presentation. Let me just highlight two important issues, and I believe that your recommendations are extremely important. Goes along with what Luisa was mentioning, but as well the importance of what you are saying, not to raise expectations that you cannot fulfill. We usually give an example, it's like screening for a disease that doesn't have any cure. So why to spend the efforts on it, and why to promote people some kind of stress that is not the one that is correct. So I believe that also that is also a role of health literacy, to explain what does exist and how can you apply for it. And then again, the communication, and I would say that we need to be where people are, and the things that you highlight are extremely important. From the life cycle approach, try to build up on the importance of to communicate, customizing our information communication levels within the roles that people in fact have and the skills that do in fact have also. So thank you very much for your experience in presentation. Now Tigran, I will give you the floor. Thank you so much.
Thank you. Thank you very much. And let me begin by expressing sincere gratitude for the hosts for inviting me to speak here at this conference. It's a privilege to have the opportunity to sit among the experts and
closes.
Just closer. Okay. Yeah. Well, I would like to thank the hosts for having me here and say that it's a privilege to have the opportunity to share this podium with wonderful experts in health literacy who have spoken. Now, I'm actually not an expert in health literacy. My job in the Council of Europe is focusing on technical cooperation, on helping member states build things, helping member states carry out reforms. And that's the experience I've been asked to share at this event. I must say that the event is also a great learning experience for myself, to learn about health literacy, to learn about the issues that exist in it. As Director Benitez mentioned earlier, health protection is both a human right and a cornerstone of democracy and social justice. He also referred to health protection being a shared responsibility. Now, this shared responsibility requires a shared or a common response as well. So it's not just shared within stakeholders in the countries themselves, but it's also shared between different countries, because health risks do not necessarily recognize borders the same way as other threats might do. So, and health literacy is one instrument to help realize this shared responsibility. What I learned today is that also that health literacy is more than just the ability to produce a leaflet or even produce a very complex awareness campaign. We were discussing with colleagues over lunch, and then from what I've heard also previous speakers to say, to me, health literacy is like a big negotiation process, right? But except you're not negotiating with one person, but you're negotiating with millions of people or hundreds of thousands of people on both sides. The beauty of that negotiation process is that you're actually negotiating for one shared result, which is general health of the population, which will benefit everyone in this negotiation process. Which is, so health literacy is a key driver of individual and public health, shaping how communities understand, react to, and manage health risks and opportunities. At least that's what I've heard today. Earlier, also, Director Benitez mentioned the outcome document of the Conference on Health Protection in October. I looked through that outcome document, and there are directions of actions. There are quite a few of them. I didn't go counting them one by one. And only one of the directions, one of the last ones, is actually health literacy. But what I've noticed is if you actually go through each one of those directions of actions, you'll see that almost none of them, if any at all, would be possible to implement without health literacy in place to support the process. So it is an extremely important area to deal with. I mean, I was looking even just an example from that same document. How can you effectively tackle addiction, for example, without public recognition that it's a mental health issue? And without actions to overcome the stigma, for example, for seeking help for addiction. So it's not just a simple process. It's this huge support instrument that all of you here have. I also heard from colleagues who spoke earlier that the importance of governments' responsibility in this and the leadership that governments should have in this. Of course, it is your role, and many of you do represent governments, it is your role to serve as primary guarantors of human rights, including the right to protection of health, according to the European Social Charter. So the health literacy is an instrument for you to fulfill that role. And the one thing that was recognized is that to fulfill that role, you need to talk to each other, right? So today, by recognizing or announcing the Rome Coalition earlier, we can say that the international cooperation was recognized as an important element and the networking and broad stakeholder engagement was recognized as an element that can play a significant role in amplifying the impact of health literacy. So what can we do together? I mean, I get to the part which is actually something I work on. What can we do together through this cooperation? First, working together adds capacity to drive collective definition of challenges, joint search for solutions to those challenges, and opportunities for innovation in tackling those challenges. The Council of Europe has done this in many other areas, as a matter of fact. As an example, for example, I'm working with national preventive mechanisms. These are the bodies in Council of Europe member states who are responsible for preventing ill treatment and torture among people deprived of their liberty. So we run a forum for national preventive mechanisms in the Council of Europe. And by bringing that forum together and bringing these people together, they've been able to discover that despite wildly different contexts they might be operating in and across the geography of the Council of Europe, they share some of the same issues, maybe packaged differently, but they share some of the same issues, which means that they can together look for solutions, learn from each other's mistakes on how they actually targeted those issues. Now, bringing stakeholders together also minimizes the siloing effect. We all speak about siloing, both in terms of information, but also in terms of the work that we're doing. And it will definitely also allow cross-border cooperation to happen. In many of the networks that the Council of Europe is operating, they come together for one thing in a conference, in a discussion, in shared work on a tool, and then they discover that they have so many things they can do together, even outside of the Council of Europe. So this breaking of the silos is an important element of coalition building, which then multiplies the benefits. So by engaging diverse stakeholders, and again, here the diversity is important. So it's not just between different countries that you break the silos, but also between different stakeholders who are responsible for this. So by engaging diverse stakeholders, policymakers, practitioners, researchers, civil society from across different sectors, you gather perspectives that enrich policy and practice. Again, an example from the Council of Europe, we have recently launched a network of execution coordinators in the Council of Europe member states. These are people who are responsible in each state for executing the judgments of the European Court of Human Rights. So we've now launched a network of those execution coordinators. And as part of that network's first products, one was a study on good practices on the systems of execution of judgment. So not on something specific, not on how a certain judgment was implemented, but rather what systems do countries have in place to allow this to happen. And we produced a report, we gathered data from 27 different countries, produced a report, and now everyone is learning from that report and getting inspired as to what they can do in their own countries, how they can improve their own systems in order to improve the implementation of judgments within each of their jurisdictions. Shared research and data, that's another one that can help everyone together to have evidence-based decision-making. Coordinated approaches also build resilience and help design rapid responses to new challenges, to new threats. Again, another example from a completely different field in the Council of Europe. We've been running a project which was targeting, which brought 10 countries together to speak about the issues related to openness of justice in the digital age, about publishing data from court decisions on the internet, etc., etc. As we were discussing the issue of transparency, we discovered all the new threats that are related to posting judicial data on the internet. And we were able to see that and start discussing, okay, but how can we counter those threats? And what could be the instruments to counter those threats? So this is another example of how bringing people together from different countries helps. Before that, they were all dealing with this issue, right? But bringing them together, bringing also experts in artificial intelligence, bringing experts in digitalization, bringing experts from outside of the judiciary, help them try to understand these threats and try to start designing responses to it. So many of these networks and fora for exchanges have evolved also into these platforms where national institutions feel safe in openly discussing their challenges and seeking advice from each other and external experts on how to best address them. The European NPM Forum, that's a great example where we started by essentially a conference 7-8 years ago, and now that's the forum where they gather more than once a year to actually openly discuss, we've got this problem, how are we going to solve this? And it's this safe space for such discussion is extremely important. Health challenges, like many other challenges we face in the increasingly globalized world, do not respect borders. I already said that. Whether it's a pandemic, rise of chronic disease, digital disinformation or misinformation, no country stands alone. And I truly believe that by connecting across borders, sharing experience, expertise, resources, and best practices, countries can collectively raise the bar on health literacy and respond to emerging threats in a timely, coordinated fashion. International cooperation, in this case, enables to pool strength, avoid duplication, and learn from each other's successes, but also from each other's failures and setbacks. This is also extremely important, learning from each other's negative experiences. Moreover, through international cooperation, the combined impact that each of your countries and governments can generate can easily exceed the sum of what each country or stakeholders can do alone. And I think that's an important big factor that speaks in favor of coalition building. So who should you bring together and who should you coordinate in such an effort? In the Rome Coalition, I mean, it's been announced, so we can speak of that. I learned today that health literacy is not solely a concern for health ministers or medical professionals. As a matter of fact, there were not only health ministers sitting at this panel during the opening, right? And we have UNAR, who's the anti-discrimination body, which is involved in this. So it is a transversal subject requiring the involvement of sectors such as education, social services, digital media, civil society, even private sector, I think, should be involved in one way or the other in this. So I'm convinced that only a multi-stakeholder approach and engagement can help tackle the full range of determinants and barriers to adequate health literacy. Many of them you already spoke about today. Cross-sectoral collaboration breaks down silos. I said that earlier, and ensures interventions and culturally and contextually relevant. Again, an example from the Execution Coordinators Network I mentioned earlier, where one of the first things that the network did when it was established was reach out to other bodies, reach out to judiciary, reach out to human rights, national human rights bodies, etc., because they clearly see the need to connect with those bodies, learn what they're doing, and try to understand how they can help them do their jobs. From my experience, every successful platform, forum, network I've had the honor to contribute to provided three key components. And it's up to you to think which of those components, in my view, all three should be in there, are important, which are a priority. First of all, they provide a platform for discussion, a platform for exchanges. That can be a conference like this, that can be electronic platforms, or a combination of many different ways in which people exchange and talk to each other. Also, they all provide jointly developed tools. And this morning we heard the Minister of Health specifically stressing we don't need more documents, we need practical tools. So successful platforms develop tools for everyone to use together. And then one other thing they require is methods of work. And this latter not only includes structure of a coalition or a forum or a network, but also ways in which you develop this structure, in which this coalition building continues. It's not a static process, it's a very dynamic process. And how you engage new stakeholders, how do you reach across outside of the coalition to actually pull in other stakeholders who might have an important effect on this. So to ensure international cooperation truly takes off and delivers, platforms like this conference specifically, play an important role in generating the political impetus and bringing together governments, fostering dialogue and shared commitment. Italy's leadership in this has been exemplary, in my view, and moving forward, you can build on this momentum clearly by first mapping out all potential stakeholders who should be engaged, by surveying their needs to determine how a future network or a coalition might best function, study successful models of other coalitions and networks. That's a very important element to do. And this is something that we have done before launching some other networks and coalitions. Once the foundation is set, it's also important to put in place channels and mechanisms for communication of joint needs and coordination of collective actions. So getting beyond simply getting together in conferences or workshops. What do you do? What are the other actions? What do you do in between? And this is extremely important. And the Council of Europe's, here I must say that the Council of Europe's subject matter expertise could be extremely important in health, but also in human rights, also in transversal areas such as artificial intelligence, digital development, freedom of information, protection of vulnerable groups, justice, anti-discrimination. We just heard the previous speaker mentioning that it's important to also engage with ECRI and with what ECRI is doing on this. So I believe that the Council of Europe serves a great platform with this multidisciplinary expertise that can help truly build this multi-stakeholder approach within this coalition. So to conclude, through robust international cooperation and networking, and by treating health literacy as a universal and transversal concern anchored in human rights, you can build inclusive, informed, and resilient societies. And by investing in such efforts now, you not only address current challenges, but also are creating lasting systems that lead to lasting benefits. So you can foresee, for example, problems, as I described before, and try to prevent them from happening through such cooperation. Through shared practices, commonly defined challenges, coordinated research, and coordinated action. And most importantly, and all of this can actually inform policies which then are built on common research and shared experiences. Thank you very much.
Thank you. Thank you very much. Let me just make some reference from one of the keywords that Tigran mentioned, like health literacy as a key driver. And I believe this is extremely important. So we can adjust. It's so important that we are having lots of people agreeing with us. Thank you. Yeah. And then some other things. I believe that you talk about working in silos. I think that's a very good discussion that we need to work on. Actually, I don't know if we should stop working in silos. I think that we can use health literacy as the glue between all of those silos, because I want that people that are expert in their field area to keep on being experts. But then again, to have this opportunity to talk with each other, I believe it's important. And then let me leave us with a final three key words, I would say: pillars on your presentation, which was like platforms, tools, and methods of work. And I believe this is a really big challenge, but let me also make some reference of something that you were mentioning, which is like to define the scope of the platform that we can use. And that, I believe, is one of the major goals that we also should focus when you are working and thinking about a different coalition. So thank you so much for your reflection, Tigran. Now we'll give the floor immediately to Signe. Go ahead. Thank you.
Thank you. And I would like to start with sharing my sincere thanks to the organizers of the conference, because I think it's very, very important platform, bringing together so many stakeholders and opening really a hope for better future for health literacy in Europe. So, but when reflecting on health literacy and how to improve our situation with health literacy in Europe, I would like to start with context. And it was already mentioned many times here that context right now is very important, and it's driving us and giving us strong motivation to work with health literacy. First is, as it was mentioned many times, it's misinformation and disinformation. But maybe I would like to add to take your attention to very different types of dis and misinformation we face right now, because we see examples like people using generative AI as psychotherapists and facing different problems in this process. And there is lack of information how to use or not to use, for example, generative AI in this process. And that's about very particular uses of different tools and problems. But there are also broader problems in this field of mis and disinformation. For example, cyber war and very big threats to different national countries in a sense of misinformation from some neighboring countries. The second context, very important point for context, is sustainability and resilience of healthcare systems. And we see it very much in our discussions at CD BIOS, where different countries remind from their different perspectives that it's very hard task to strengthen resilience of healthcare systems, especially after COVID time, and make our healthcare systems sustainable. It's also about trust in healthcare systems and trust in governments, which all together is bringing different problems, and also in the field of health literacy. So, and one more point, if we speak about context, is need for a strong leadership and need for co-working, both at national levels, I mean leadership and co-working of national authorities in the field of health literacy, but at the same time, also very strong need for leadership and co-working at the European level, where European countries must work together. So in any case, health literacy has to be approached as societal issue, and it's not a separate responsibility of individuals or separate responsibility of healthcare professionals or policymakers. It really requires collaboration between different sectors, and multiple stakeholders must be involved by at governmental level, and there is strong need also for strategic planning. So I'm representing also Latvia, and I think it's important that there are very different countries in Europe. There are small countries and big countries. I'm representing a small country here, and I think that small countries are facing very specific challenges, and our situation might, in many respects, be also different from big countries. We have done some homework in Latvia already, and when Christina spoke about national vulnerability scans, I can share our experience. We currently are implementing a state research program aiming at mapping problems in health literacy, and we are developing also some tools for improving health literacy. I'm leading a work package on patient rights as a part of health literacy in this project. And when our Ministry of Health developed idea about this national project, it was clear that we need a separate work package on patient rights, because we see that patient rights is important part of health literacy, because if people lack knowledge and understanding about their rights, they might not reach even those healthcare system tools and opportunities which are available. They just don't know about them, or they don't understand. So the results of our project so far shows that the problems are quite similar to many problems mentioned here in previous presentations. There are certain vulnerable populations and with lower health literacy. Particular groups are especially vulnerable, elderly people, and I think it goes together with aging of our societies, and we will need more and more support to elderly population, also in terms of health literacy, and we need specific approaches to reach out to this population. For example, digital gap might be a serious problem for this part of population. We might have the best tools available on internet, but then if people don't use internet, or they are not so comfortable with using digital tools, then it will not help this particular group. Or we see that people with lower levels of education, they also have lower levels of health literacy. And we also notice that specific groups of people with disabilities, and here were mentioned people with hearing and vision disabilities, and we particularly saw that there are problems in health literacy, access to materials to health literacy. In these particular groups, we interviewed these groups separately, and they shared their experience, and we see that there is a lot to do to help these groups. I can share also some examples where we saw problems in the process of healthcare, or in the patient journey. Maybe we should speak more about patient journey. For one example was discharge from the hospital, where we provide a very high-level treatment to people, for example, with stroke. And at the point where they are discharging from the hospital, they don't get the necessary information. They don't understand where to seek rehabilitation, where to get further support. And it means that people who have very good social contacts, they are educated, they will get the necessary rehabilitation afterwards. But many people are left behind, unfortunately. And we see that there is a need for very targeted interventions at particular points in the patient journey to make this patient journey successful, and not to lose the very good job which is done by the doctors at the hospital, because so we might lose all what is already done. So in a broad sense, we also face many problems in education on health literacy at schools in Latvia. I think we can find countries which will share these problems. And But a different level is education of healthcare professionals, and not only further education, but also education of medical students. I'm working with medical students a lot, and I can confess that we are not ideally equipped with tools or materials how to prepare our medical students or nursing students or all future healthcare professionals to help their patients, and also to build organizational healthcare, organizational health literacy. So one tool we have CD Bio Guide on health literacy, and I'm proud that we have translated it to Latvian. And I really encourage all countries which haven't translated it to do it, because I think it's something we already have and can use. But in any case, we should remember that population health literacy, it tends to mirror social stratification, and without intervention and without very targeted actions, these disparities risk to increase inequities in access and outcomes. And maybe I will finish with what we need as countries and collaborations of countries. I think one very important thing we need is a toolbox, really toolbox of interventions. There is a very good starting point with best practices in CD Bio Guide on health literacy, but we have many specific needs, many specific groups where collaboration and coordinated action would be extremely important, not to duplicate efforts, for example. If we duplicate efforts in every country and then spend a lot of money, why don't we do it as a common effort? And at European level, coalition would be the right way indeed to collaborate, to share knowledge, to share best practices, and maybe the most important, demonstrate the goodwill by governments to develop health literacy. Thank you.
Thank you very much, Sigyn. Thank you so much for your perspective. I think you get a broader highlight on the perspective, mostly of the patients, of the population. And there's very good examples from where can we move forward. Let me just highlight a report from OECD that I believe that could be really helpful for all of us, which is the Paris report, which was really, really useful because it got like the highlight of the preferences of the population and how do they felt facing the healthcare, from primary healthcare to hospital care. So I believe that we can also use some of the sources that can be really important for the work that we are promoting now. And the idea of the toolbox, I think it's really what countries do in fact need, with the possibility and opportunity, and they have lots of examples, very good examples of what you're mentioning, but with the possibility and opportunity to be broader enough so we can fit our cultural adjustments, our reality, and mostly, and this is something that we've been discussed for these past 3 years, making policies for the real world. And I thank you so much for your perspective. Thank you. So now we'll give the floor to the last panelist, to Luciana, and thank you so much.
Grazie. I'm going to conclude the session in Italian. Permettetemi di ringraziare l'UNAR, di ringraziare il Consiglio d'Europa. Essere qui come Centro Nazionale Sangue è una grande opportunità e veramente un profondo grazie per averci coinvolti in questa sfidante avventura. Il Centro Nazionale Sangue per i non addetti ai lavori è quell'organismo che sostanzialmente si occupa, a fianco ovviamente del Ministero della Salute, di quello che è l'approvvigionamento di sangue, prodotti del sangue, plasma derivati, quindi farmaci spesso salvavita, che possa, in maniera da poter garantire una autosufficienza e comunque una capacità di cura e di accesso alle cure per tutti i pazienti. Ora, perché la donazione di sangue in questo contesto? Allora, innanzitutto per chi lavora nell'ambito del sistema trasfusionale, quando si parla di promozione della donazione, si parla di promuovere una donazione volontaria, solidaristica, non remunerata, una donazione, un tipo di donazione a cui, per esempio, in questo momento l'Europa ci chiama fortemente con un nuovo regolamento sulle sostanze di origine umana. Quindi sostanzialmente noi dobbiamo convincere un cittadino, spesso un giovane cittadino, che perdere tempo, fermarsi a donare sangue è un qualcosa che in realtà non è una perdita, ma è un valore che aggiunge qualcosa alla sua personalità, al suo vissuto, alla sua esperienza. Ora, qui c'è già il primo, una delle prime keywords che ho sentito più volte ripetere oggi, la comunicazione. Quindi dobbiamo essere capaci di comunicare questo valore, il valore del dono. Non dobbiamo solo saper far questo, noi dobbiamo anche saper dimostrare a chi abbiamo davanti che la consapevolezza dell'atto che lui sta facendo è un atto sanitario e che le sue scelte, le sue abitudini, il suo stile di vita hanno in qualche maniera un impatto su qualcun altro che riceverà il suo dono. Quindi questo diventa, io penso a tutti gli effetti, un momento in cui noi possiamo promuovere nel nostro piccolo una forma di health literacy, dando informazioni, combattendo misinformazioni e cercando di educare appunto le persone in questo senso. In questo caso il ruolo della consapevolezza sanitaria è fondamentale. Noi sappiamo che la donazione solidaristica è garanzia di sicurezza, è garanzia di qualità. E questo deve essere un qualcosa che va in qualche modo trasferito a chi dona, perché rende la persona che dona, il donatore, partecipe di un qualcosa che va ben al di là della sua scelta personale, ma che diventa una strategia, ha un impatto non solo sociale, ma ha un impatto sanitario a tutti gli effetti. Quindi il nostro ambito è un ambito in cui si intersecano diverse effettivamente valenze. Da una parte abbiamo ambiti non sanitari, dall'altra abbiamo professionisti, ma in ogni caso ci deve essere la capacità di essere rete e in questo credo che la consapevolezza di essere strumento di alfabetizzazione sanitaria è un qualcosa che deve permeare in questo sistema, ancor più perché, se vogliamo, noi riusciamo a lavorare in questo in un momento privilegiato della vita delle persone, in cui la persona che dona o che può donare è in un momento di benessere fisico e non in un momento di malattia. Quindi credo che questo tipo di modello, il modello sangue, possa nel suo piccolo essere comunque uno strumento di health literacy, soprattutto anche perché si rivolge ai giovani. Abbiamo sentito parlare della rilevanza delle tecnologie, delle nuove tecnologie. L'introduzione di nuove tecnologie nell'ambito della medicina trasfusionale in generale, ma ancor più nella donazione per il recruitment di nuovi donatori, è fondamentale. Quindi dobbiamo essere anche capaci di trovare modalità giuste di trasferire non solo la conoscenza, ma appunto questo approccio alla donazione. Infine, quello che mi piacerebbe sottolineare è che c'è da parte dei professionisti del mondo trasfusionale probabilmente la possibilità di prendere maggior consapevolezza di questo aspetto e di essere strumento essi stessi in un mondo che è comunque un mondo sanitario sempre più in cui l'accesso alle cure è sempre più complesso, in cui le cure si diversificano sempre più e quindi prendere consapevolezza che ognuno per la sua parte può contribuire a fare informazione, anche se abbiamo detto forse è meglio parlare di alfabetizzazione, quindi a generare una consapevolezza, in questo caso nel mondo della donazione. Il mondo della donazione di sangue, che è un mondo in cui, devo dire, è presente moltissimo il valore della cooperazione e della collaborazione, che va anche al di là forse del trasferimento di conoscenze scientifiche o di procedure, ma che in realtà è molto bello anche perché è un mondo che ci permette di trasferire dei valori come quello appunto della donazione, dell'altruismo nella donazione, in cui non si cerca compenso ma si è in qualche maniera ricompensati dalla reciprocità della solidarietà che si trova e che quindi sono valori assolutamente rilevanti, fondamentali quando vogliamo garantire un accesso equo a tutti alle possibilità di cure. Grazie.
So thank you very much to Luciana. Let me just highlight, because we are getting with a lack of time, my apologies for that. About the introduction of new technologies, I believe this is really one of the biggest challenges that not only how to reach people, but as well a challenge on health literacy and how can the government, the institutions also move forward, and especially move at the speed that things are changing, that sometimes that's probably one of the major issues that in fact we have to move along with the velocity that the other ones also have. So thank you so much. Thank you so much to all of you. It was great presentations. I think that now we can have some 20 minutes more or less, so we can keep on time to have some questions from the audience. And I will give you the floor immediately. Where are you already, a colleague? So please. Probably introduce yourself and set the question or the comment. Thank you so much.
Grazie mille, io sono Nicola Dell'Arciprete e intervengo a nome dell'UNICEF più con una considerazione aggiuntiva piuttosto che una domanda. Ci tenevo molto a nome della nostra organizzazione a ringraziare le autorità italiane e il Consiglio d'Europa per la leadership che stanno dimostrando su un tema così importante e cruciale anche per il nostro mandato sui diritti dell'infanzia. Aggiungerò qualche considerazione in inglese molto brevemente, perché sono più abituato ad usare quella lingua con il linguaggio tecnico. But as you can imagine, even for us, health literacy is a cornerstone of equity and universal health coverage. It is not simply the ability to read information, it is the ability, particularly for families, to access, understand, and act on health guidance. And for the most vulnerable children and caregivers, I mean here refugees, migrants, Roma, ethnic minorities, children with disabilities, health literacies can mean the difference between protection and exclusion. We know there is already a number of persistent pockets of disadvantage across Europe and Central Asia. These are linked to poverty, to discrimination, to language barriers that still limit access to essential health and social services. So we really believe that without a targeted and sustained action, too many children risk being left behind in immunization, nutrition, mental health, and early childhood care. We really welcome the establishment of this coalition here in Rome. I think this is a very important space to mobilize all of the energies around this agenda. There is 4 points on which we as UNICEF, we would be very pleased to be involved and contribute to your agenda. The first is inclusive information and communication. I think it's very important to deliver clear, multilingual, culturally appropriate content using child-friendly and disability accessible formats. We have experiences also with digital tools in this respect, including here in Italy. The second is community-based delivery and navigation. As you all know, community health workers and cultural mediators play an essential role in helping families navigate the complexity of health systems in every country. On this, I can mention Roma health mediators in Serbia, for instance, that have increased the uptake in preventing care while strengthening trust between families and service providers. A third point is child and disability responsive systems. We need organizational health literacy embedded within primary health care and education systems. These, as it has been mentioned, the cross-sectoral nature, it's extremely important to make this whole agenda work. And finally, I think an important point is accountability and participation. A lot has been said about co-creation. I think the impact of whatever we do on these issues will be measured through youth feedback loops and service data. I think the involvement of young people in particular will be critical to ensure any success on this agenda. So as you can see, we have an approach that is very closely aligned with the Council of Europe Guide to Health Literacy, and we really look forward to continue the conversation with you, being involved and contributing as we all move forward on these issues. Thank you.
Thank you. Thank you so much. I think that we have 2 more questions, and then I will give the floor to one of the colleagues that probably can make. Do you want Lorenzo to make any? No? Okay. Okay. Cristina?
Okay. My name is Cristina Vaz de Almeida. I'm president of Portuguese Society of Health Literacy. Congratulations to this table and to Lorenzo Montrazio, Lihia Bard, Christine Sorensen, and Mattia Peradotto, because this is quite important for us. Some of you say during the panel that we don't need more studies. We have a lot of studies in health literacy. And in Portugal, we combine the part of the strategic with public policies with Miguel Arriaga and public policies, and also with the community interventions and to increase the level of health literacy. I will bring 4 cases, practice, because I think we must need the best practice that we have, because we have in several countries. For example, we have the course of the postgraduate course for health literacy, the unique exclusively in Portugal since 2012, and Christine Sorensen and Miguel Arriaga are one of the teachers. Thank you. And this is practice to train health professionals, practice. And we have trained a lot of them. The second point is for migrants, because some of you speak about migrants. We have Acolher. It's a program for refugees and migrants that we give capacity to these migrants through some training sessions screening, collective consultations. We have several people that are with cancer, and we organize with informed consent some collective consultations because to decrease the level of health in Portugal. And this is coming very well, and Professor Miguel is also a consultant of this project. The third one is we have talk about disability. We have a project that we need to be different. It's with the disability people, and we go through hard to speak in schools about disability. They dance, and we talk about in wheelchairs, and we talk about the ethics, the values of disability people. This functions very well. Fourth, fourth, we have mini assemblies of health. We ask people what they want along the life cycle. For elder people, we have mini assemblies. For disability people, for migrants, we are the responsibles of the program of health literacy and Azores, and Professor Miguel also is of course, in the program. And this is good practice. And finally, for elder people, we have Activar. Activar is for increase in seniors universities the level of understanding of medical reconciliation, vaccination, health, oral health, and others. So maybe we can, for the forward programs that we can have to bring the best practice, because it's the real life. I know that we need to make the bridge with political issues, but we have in Portugal a very good example, and Miguel Arriaga is one of the best examples that politicians and scientific societies, academic and communities work well. Thank you, Miguel.
Thank you. Okay, thank you so much. Then we can make a comment, but I have one other question. Thank you.
Thank you. More than a comment, I have a question. I prefer to speak in Italian, perhaps it's more easy. Grazie per questo interessantissimo meeting e per gli speaker per I loro interventi. My question is related to the fact that information, as you told us, is very important for the health literacy. But information is too much in either online, either in several other by social media and so on. What I think is that we have to distinguish between the, how can I say, the certificate information and the sponsorized information, which is often something which is misleading for the people. So what I would like to say is that this is a question for the Council of Europe, for example. Don't you think that it's important to have a sort of labeling of sites of information providers that are, how can I say, institutional providers, and the providers of information on scientific or medical issues that are not always certificated or essentially private interests behind, for instance, for a drug or for a physician which would like to make sort of a commercial intervention. So the question is it possible to have a strategy in Europe to introduce only the sites dedicated to medical information, for example, that are of interest, they are certificated of safe, with respect to a lot of information that come from several not, how can I say, not sure people or intervention by small agencies or private interests. Thank you.
Thank you. Thank you so much. So if you allow me, let's get this set of questions, and maybe we can start from the last one, And Tigran, do you want to have the floor, and then probably some other colleagues as well?
Thank you very much. This is a very interesting question. I might not be able to answer it in a way that will that will give a final solution. And it's clear that certifying information could be one of the solutions. But from what I heard today about health literacy, it's not just about silencing wrong information. It's about building trust towards the correct information. So from that point of view, I'm not 100% sure that certification is the solution, and it can be one of the solutions. In some cases, it should be, and I fully agree that advertisement, for example, should be labeled as such, right? Advertisement should be labeled as advertisement, and that's clear. And many of the countries actually have laws that require advertisement to be labeled as such. But I think, and you're absolutely right. There's a huge noise of information happening, but this again brings us back to the point of health literacy not being just information, right? You have your objectives, and there might be different ways to reach those objectives, and there might be different sources of information that people will turn to, or sources of advice that people will turn to. So looking at where they're looking, what they're getting, because simple certification might not necessarily solve the problem that you're talking about. Having said that, I'm not saying it shouldn't happen. I'm just saying that I think we need to look at the problem in a broader manner to try to first understand fully its structure and then go with individual solutions. And again, context may be very different for some groups and completely different for others. But as I said, I don't promise a full answer, just some thoughts about your suggestion.
That the fight against the fake news is so important that we have to stop.
Absolutely, and that's one of the and I can see one of my colleagues actually asking, and fight against disinformation and finding ways to fight disinformation, not only in health literacy but in everything, is extremely important. This is why our Secretary General has also proposed the new Democratic Pact for Europe. And one of the key elements of that is fighting disinformation. So, I mean, I absolutely agree with you on that one.
Thank you so much, Tigran. There's a colleague that probably wants to add something. Yeah, thank you.
Hello, everyone. My name is Şeyma Yusra. I'm a medical doctor from Turkey, Turkish Ministry of Health. I'm here because I was responsible for the implementation of National Health Literacy Action Plan for the past 4 years. So I would like to thank the Council of Europe and UNAR for organizing this excellent conference and for the inspiring discussions today, and especially giving space for young people, young professionals here. Before I ask my question, I would like to briefly share a promising example from Turkey, my country. We've been implementing a wide range of community-based health promotion programs in our Healthy Life centers. We have them in all of our cities based on populations. The numbers change. One of our newest initiatives is Healthy Life Academies. And where we bring small groups of 5 to 10 people together to improve their health literacy on different topics. It's a very structured program. So we conduct pre and post assessments. And since the program started nationwide in April, the results have been very encouraging and promising. However, we are facing a major challenge. It's participation. From my perspective, unfortunately, reaching people is difficult, as if there is an invisible barrier between these services and the communities who would benefit the most of the services. So my question is to panelists, or for all the participants, how can we make such centers stronger attraction points for the public? To truly engage communities and empower them as an active participants in their own health literacy journey. Thank you.
Thank you. Thank you very much. Does anyone wants to go ahead and have the floor? So community engagement, please, Signy, go ahead.
Yeah, it's a short comment, but I think in the whole conversation today, we didn't mention cultural industries and sector. And in Latvia, we have at least one, I think, quite successful example where Museum of History of Medicine, they launched a program of health literacy for children. And they, as a cultural institution, they have a bit different face. People look differently at cultural institutions. So I think it's a small part, but maybe some cultural institutions might be involved if we speak also about minority groups, etc., etc. So that's one small option, maybe.
Thank you so much. May I just add a little something that goes along, not having my role as moderator, but having something that I feel it's important. I believe that when we are talking about engaging the community and also communicate, in fact, we need to step a little, probably sometimes a step forward or backwards, and first of all, ask people what to, in fact, do they need. And this is what sometimes misinformation, fake news do as well. They are answering, in fact, what people do are asking. And sometimes from our level, we think that we know what people do need without asking them. And I believe that sometimes could be really important. So if we want to engage someone, to ask them first and not to feel that we are telling them what they need. But this is really a challenge. It's really hard. As it is a challenge, let me get like 2 words without moving for the final question. It's sustainability of the process. So to become sustainable in all of the things that we are doing. And then again, to allow people to give them the answers and the opportunities that they can be, that we are there for them. And this is really a challenge. And also not only to work in small projects, but moving a little bit forward and work in a public health approach. Because we know that some of these projects in schools, in hospitals, in primary healthcare facilities and so on, they are really important. But then when it comes to enlarge them, to scale them up for the national level, then problems start. And when financial problems are also coming. So I think that we should need to work out in an approach that can build up something that we talked about last year a lot, which is to build up ecosystems that can make it easier for us to analyze and to work on these different areas. To work with fake news and misinformation is a huge challenge, but I believe that if we occupy the communication space, probably we are at least trying to be where people are, and this is also right important. So I think that we have time for one final question. Does anyone? Yes, we have maybe 2 final very quick questions. Yeah, if it's okay. So put them 2 together, and then we can get the answer. Thank you. Go ahead.
Hello. My name is Emanuele Valenti. I am a student of the Università Politecnica delle Marche in Ancona, and a student of Professor Luisa Borgia. And first, I would like to thank you all and the organizers for this magnificent conference. And regarding my question, I especially appreciated during this conference the frequent references to the role of technology and artificial intelligence in health literacy. And my question is, given that AI is increasingly present in healthcare systems and that there is still, at least in Italy, no specific mandatory training for doctors, there are trainings but they are not mandatory, how can we ensure that healthcare professionals are adequately prepared to use these technologies safely and ethically? And to further add, what transparent, informed consent models are most effective for ensuring that patients understand algorithms, risks, limitations, and the use of their data, while avoiding new inequalities in understanding clinical information, which is enriched of new but potentially confusing words? Thank you.
Thank you very much. Thank you. Go ahead, please.
Pedro Barata from the European Medical Association. First of all, thank you for the panel for their presentation. So as it was mentioned today, we currently have various organizations and multiple bodies just working in silos. So basically everyone in this room is doing health literacy. My main question is, should this be just a main responsibility of the government, of Ministry of Health, Ministry of Education? What role does civil society organizations and NGOs play here? And on the other side, we have a lot of misinformation related to health. Should there be consequences for those that spread misinformation in this field? Thank you.
Thank you very much. Now I'll give the floor to the colleagues. Does anyone want to make some comments on the two questions? Maybe the first one with the use of AI. Go ahead, please.
No, I just wanted to say, especially on the involvement of civil society organization, and also it gives also a suggestion to what was saying on the communities. I think that yes, civil society organizations can help on building trust, because what we have seen, for example, especially the disadvantaged group, they start with a lack of trust toward the public institutions. And so I think that to have these intermediaries that are citizens and are part of civil society organizations, which really know their needs and how to speak and how to specify the message and the communication toward these communities, I think they can help on this perspective. But of course, civil society organizations themselves should be health literated on to better understand themselves what is the need and why is this important, and then they can intermediate between communities and health institutions or health representatives.
Thank you very much, Robert. Tigran, go ahead. And then Luisa, yeah.
I might actually try to reflect on the first question regarding the use of AI in healthcare in general. And here I think it's important to recall the Council of Europe's work on trying to give the countries tools in order to be able to measure the impact of AI tools on human rights and democracy. Most notably, you might have heard about the Huderia tool, which is essentially a set of tools to assess various either instruments, programs, or specific IT instruments, and they're essentially the impact of AI on human. So that could be one of the ways to try to fix the issue that you're mentioning, and try to see, first of all, what is the impact, how high risk that impact is, and what can be done to moderate, to mediate that impact, if there's a risk, to mediate the risk.
Thank you so much, Luisa. Yeah, go ahead.
Allora, due piccole considerazioni. La prima, per quanto riguarda il discorso della come fare con l'intelligenza artificiale, che è diventato uno strumento di comunicazione tra paziente e medico, quindi come può incidere nel rapporto medico-paziente, ritorno a quanto ho detto nel mio intervento, e cioè che secondo me è fondamentale che la health literacy cammini su due livelli, un livello apicale e un livello di rete basica. Il livello di rete basica, nella mia prospettiva, è inserire all'interno dei curricula formativi dei professionisti sanitari, in particolare quindi nelle università, questi argomenti, cioè come utilizzare gli strumenti. Ci sono gli strumenti, sono nuovi, dobbiamo essere al passo con i tempi. Quindi accanto alle materie deputate dobbiamo anche dotare i nostri professionisti dell'utilizzo di questi nuovi strumenti, ed è questa la cosa minimale che secondo me dovremmo cominciare a fare. Quindi lavorare insieme come paesi su alcuni argomenti trasversali e comuni nella preparazione accademica, e potrebbe essere uno. E poi volevo cogliere l'occasione, per quanto riguarda la parte apicale, sempre in una prospettiva di comitati nazionali per la bioetica, mi ricollego a quanto detto dal collega sulle piattaforme. Allora, possiamo utilizzare piattaforme della bioetica. Ne abbiamo due a disposizione fondamentali, una europea e una mondiale. La piattaforma europea è quella dei NEC Forum, che sono organizzati dalla Commissione europea ogni 6 mesi nel paese che ospita la presidenza di turno, e chiamano a raccolta i comitati nazionali dell'Europa. Quindi noi possiamo utilizzare questa piattaforma per cominciare a, per esempio, diffondere la notizia della coalizione di Roma. cominciamo, ed è una piattaforma che possiamo utilizzare e cominciamo a produrre informazione. La seconda piattaforma, che è quella mondiale, è quella del Global Summit dei Comitati Nazionali per la Bioetica, che è organizzato invece dall'OMS, che si tiene ogni 2 anni, e in questa piattaforma, in questo momento storico, San Marino piccolina può dare un contributo, in quanto l'anno scorso abbiamo ospitato per la prima volta in un piccolo paese il Global Summit, ma San Marino è nella steering committee per la preparazione del prossimo Global Summit, che si terrà a dicembre 2026 in Bangladesh. Quindi possiamo utilizzare quella piattaforma per cominciare a diffondere anche ai colleghi extra UE questa notizia. E quindi questa è una proposta, insomma, che vi faccio, molto concreta. Cominciamo dalle piccole cose, per quello che mi consta cominciamo dalle cose concrete. Questa, insomma, è la mia proposta. Grazie.
Thank you so much. So I believe this is the best way probably to finish our session. Let me thank all the colleagues from this roundtable that I have the privilege to be the moderator. And let me thank you again to the colleagues from the Italian institutions. Thank you so much again for the invitation. Thank you so much for leading this process. We believe it's really, really important, as well as the European Council of that is absolutely decisive within our structure in the way that we are fulfilling all of our work. So thank you so much to both of the institutions. Thank you again to the colleagues, and thank you so much to all of you that contribute for this roundtable. Thank you.
Grazie davvero a tutte e tutti, grazie ancora anche a Miguel per la moderazione del panel, dell'ultimo panel, e noi andiamo un po' a tirare le fila di questa conferenza, di questa terza conferenza, e a chiudere un po' la giornata odierna insieme al direttore Benitez, ed è quindi per me un vero piacere poter effettivamente tirare le fila un po' dei contributi che hanno animato la giornata odierna e che ci hanno confermato ancora di più come effettivamente l'alfabetizzazione sanitaria non sia solo un tema tecnico, ma un nodo strategico di diritti, di resilienza democratica e di costruzione di fiducia. Lo è tanto più oggi un tema centrale, in un tempo in cui la complessità anche dei sistemi sanitari, sicuramente la complessità data dalla trasformazione digitale, lo sentivamo anche nelle domande adesso, la diffusione della disinformazione rischiano di allontanare le persone dalle istituzioni proprio quando avrebbero invece più bisogno di essere vicine a queste istituzioni e di essere protette un po' e accompagnate dalle istituzioni in un percorso rilevante di godimento di diritti e di vero enjoyment appunto dei diritti, anche tra i quali appunto il diritto alla salute. Sin dalla sessione inaugurale la ministra Eugenia Roccella, che ringrazio ancora non solo per la presenza ma proprio per aver dato un impulso forte a questo tipo di tema, al lavoro che l'Ufficio Nazionale Antidiscriminazioni Razziali può fare e continua a fare su questo tema, anche per il tramite della professoressa Morresi, e il ministro Schillaci hanno richiamato l'importanza di collocare l'alfabetizzazione sanitaria nel cuore delle politiche pubbliche come strumento di effettiva tutela dei diritti fondamentali, capace quindi lo strumento di rendere effettivo e vivo il principio di accesso equo alle cure, come sancito e come ha ricordato prima anche il direttore Benitez, dalla Carta Sociale Europea e dalla Convenzione di Oviedo. Ricordava sempre il direttore che sono questi quadri giuridici che non definiscono effettivamente solo dei doveri, ma piuttosto un orizzonte di vita democratica collettiva che decidiamo effettivamente di mettere in pratica con questo tipo di meccanismi, di convenzioni, di modalità di stare insieme. Nel corso della mattinata gli interventi dei rappresentanti di Albania e Grecia hanno ribadito che questo impegno è condiviso, è un impegno trasversale e che costruire fiducia significa ascoltare le persone, le loro difficoltà, ascoltare e guardare le differenze tra le persone, ascoltare anche le comunità più distanti dai servizi sanitari. Noi abbiamo cercato e cerchiamo di farlo quotidianamente e lo abbiamo anche sentito un po' dal progetto che raccontava questa mattina la professoressa Morresi, quello che abbiamo lanciato e costruito insieme a Università Cattolica, insieme a Croce Rossa Italiana e al Centro Nazionale del Sangue, proprio sul supporto alle comunità rome-sinte cosiddette hard to reach, quindi più lontane da quella che è un elemento di inclusione, di vero godimento di diversi diritti, tra cui anche il diritto effettivamente a un accesso equo alla salute e a vari diritti fondamentali. E la sintesi offerta poi nella mattinata da Lorenzo Montrasio ha mostrato anche con chiarezza come tutti gli interventi convergano verso una medesima direzione: fare sicuramente di più, ma soprattutto farlo insieme, farlo come una comunità di pratica, come una comunità di intervento, come una comunità anche di paesi che si mettono assieme per fare delle attività specifiche su questo tema e su questo settore. Il pomeriggio ha ulteriormente ampliato questo quadro, grazie alle riflessioni degli esperti, dei professori, che hanno mostrato non solo il valore della ricerca e della formazione, ma anche dell'educazione come strumento indispensabile per rendere le politiche effettivamente operative. Abbiamo visto come l'alfabetizzazione sanitaria, quando è radicata veramente nelle comunità e nei contesti territoriali e soprattutto nelle vite delle persone, può diventare e diventa, come diceva questa mattina la Ministra, un fattore di empowerment, capace di ridurre barriere nell'accesso ai servizi, migliorare l'aderenza ai percorsi di cura, contrastare la disinformazione, rafforzare la partecipazione e rendere fondamentalmente conseguenti nell'implementazione i servizi e le risposte al bisogno di salute, anche per rispondere alla domanda sollevata da Robert poco fa. Permettetemi quindi di richiamare, a mio avviso, 4 macro direttrici emerse un po' dai lavori di oggi. Il legame strutturale tra alfabetizzazione sanitaria e democrazia. Come si è detto in tutti gli interventi, l'alfabetizzazione sanitaria non è solo un fattore limitato all'ambito della salute, è un elemento costitutivo di una vita democratica piena e quindi del godimento dei diritti in questa vita di relazione democratica piena. Non vi è infatti un esercizio effettivo dei diritti senza un accesso comprensibile alle informazioni, capacità di orientarsi, possibilità di scegliere consapevolmente. Focus su persone e gruppi in situazioni di vulnerabilità. Le testimonianze di oggi, ma anche le testimonianze un po' che portiamo avanti quotidianamente nel lavoro, in particolare parlo da questo punto di vista nel lavoro ad esempio di UNAR, hanno mostrato come la scarsa alfabetizzazione sanitaria sia spesso correlata a marginalità, discriminazione, derivante anche da barriere culturali e linguistiche, e come invece la coalizione di Roma nasce proprio per mettere al centro chi oggi è più distante dai servizi sanitari, dalle risposte che lo Stato mette in campo per assicurare il godimento dei diritti, e quindi nasce con lo spirito di costruire fiducia dove oggi fiducia non c'è, o dove la fiducia è un po' sfibrata in quella che è un elemento di capacità di costruzione comunitaria e di rafforzamento appunto di questa fiducia che oggi è fragile. La necessità sicuramente di un approccio multilivello, molto concreto, misurabile. La coalizione non sarà certamente un esercizio simbolico, non siamo qui per, come diceva anche il ministro Schillaci, scrivere qualche bel discorso o paper, siamo qui per far vivere uno spazio operativo in cui governi, istituzioni sanitarie, organismi indipendenti, università, mondo accademico, società civile siano capaci di proporre strumenti effettivi, condividere e promuovere formazione, linee guida, accompagnare politiche nazionali che diventano poi politiche di godimento dei diritti nel locale, nella vita delle persone, che cammineranno con con le persone stesse. E per chiudere, Su queste 4 direttrici la centralità anche del Consiglio d'Europa, un po' ricordata da tutti gli attori. Tutti hanno riconosciuto il ruolo unico che il Consiglio d'Europa ha su questo tema, la capacità di mettere insieme, di essere un po' garante dei diritti umani e di agire come una piattaforma capace di trasformare volontà e impegni politici in standard, linee guida, programmi di cooperazione, strumenti effettivi per far vivere questi impegni. La richiesta condivisa dai Paesi, ma che il direttore Benitez ha già accolto, è che il Consiglio d'Europa coordini e rafforzi le azioni della futura coalizione e questo sforzo che abbiamo cercato di mettere in campo assieme oggi. L'Italia, come ricordato innanzitutto dalla ministra Roccella, ma anche da altri interventi, ha scelto di investire fortemente, in maniera forte politicamente e istituzionalmente in questo percorso. Lo ha fatto dal 2023 ospitando e sostenendo 3 conferenze internazionali, lo fa oggi con il lancio della coalizione di Roma, ma continuerà a farlo mettendo a disposizione competenze, esperienze varie e diffuse e il tentativo di dare una capacità di coordinamento a questo sforzo nazionale ma sovranazionale. E aggiungo anche che l'Italia è impegnata non solo appunto sul piano politico, lo ricordavo prima, ma attraverso progetti concreti come quello sull'integrazione sanitaria delle comunità rom e sinte, che mostrano come l'alfabetizzazione sanitaria possa diventare strumento reale di inclusione, riduzione delle disuguaglianze, prevenzione delle discriminazioni e quindi può essere effettivamente un esempio concreto di ciò che la coalizione potrà portare su una scala più alta della scala nazionale, su una scala perlomeno europea se non internazionale. Oggi abbiamo quindi dato avvio a un processo che non si limita a enunciare un impegno, ma definisce una direzione abbastanza chiara: rafforzare il legame tra decisione politica e cittadini, favorire la collaborazione internazionale e la condivisione di pratiche, promuovere alfabetizzazione sanitaria e diritti umani come pilastri di una democrazia inclusiva e coinvolgere istituzioni, professionisti, comunità, organismi indipendenti. La coalizione di Roma sarà quindi uno spazio aperto, dinamico, costruito passo dopo passo in realtà con tutti voi, con tutte e tutti voi, che non nasce solo come un'iniziativa di un singolo paese, ma piuttosto come bene comune di una comunità più ampia, radicato in una tradizione democratica del Consiglio d'Europa e nello sviluppo appunto di quei meccanismi multilivello e sovranazionali che il Consiglio ci ha ricordato questa mattina. Chiudo ringraziando tutti i relatori, i moderatori, le delegazioni nazionali, gli esperti e le esperte che hanno contribuito in maniera fondamentale al nostro lavoro, ringraziando di nuovo chiaramente la ministra Roccella e il ministro Schillaci per la partecipazione, per l'impegno e il costante supporto che danno anche all'ufficio su questo tipo di attività, ringraziando il direttore Benitez per la presenza, per il ruolo decisivo che il Consiglio d'Europa continua a svolgere, ringraziando Assuntina Morresi per il ruolo di guida che ha avuto nell'immaginare questo tipo di percorso e nel farlo accadere. Spesso le cose appunto accadono perché si decide di farle accadere, non accadono per caso. E ringrazio infine chiaramente tutto l'Ufficio Nazionale Antidiscriminazioni Razziali, tutto lo staff di UNAR, e in modo particolare Agnese Canevari, Lorenzo Montrasio, ma permettetemi di fare anche un grande applauso a Luca Borri per l'organizzazione di tutta la conferenza, perché appunto non solo le grandi conferenze, ma poi anche il poterle mettere in pratica spesso camminano sulle fatiche delle persone che lavorano con noi e quindi è importante riconoscere questo momento diciamo di sforzo collettivo. E da oggi in realtà iniziamo quindi a rafforzare il lavoro sulla coalizione di Roma con lo stesso spirito di fiducia, di responsabilità e di cooperazione che ha animato sicuramente questa giornata, e grazie ancora al direttore Benitez per il suo supporto e soprattutto per darci anche gli ultimi saluti rispetto alla coalizione e al percorso che abbiamo fatto oggi. Grazie mille.
So I have good news. I'll be much shorter because I think everything has been said and there's very little to add to this excellent summary that Dr. Peradotto has made. I would nevertheless like to say some things, but I promise I will not be very long. First of all, I would also like to associate the Council of Europe ourselves. Thanks to all of those who have made this conference possible, and in particular to the ministry and to the minister, but also to UNAR, and not only thanks for this third edition, but more generally thanks for being there, for thinking about the importance of these things, for making us all aware that this has very far-reaching implications for the well-being of people, ultimately, and this is really about people. For thinking of the Council of Europe, it's not very often that people think about the Council of Europe, so it's great to know that there are those there, and we know they are, and many of them are around here, who realize the importance of human rights, the importance of the instruments, because this is not just about words. It's not very difficult to use the words. What is more difficult is to understand, to know, and to understand what those words mean, the systems which are behind, and the opportunities which are there for people to lead their lives how they best fit, at the same time being part of a community and decide about the community, and at the same time knowing that the state, that the authorities are there to give them the best chances. The second thought that comes to my mind is that we now have the coalition, and I already feel Roman. I have even improved a little bit my Italian. I think this coalition is an extraordinary opportunity to not only gather additional political support at a time which I think is very favorable. I think we are, interestingly enough, we're living one of the most critical times, I think, in terms of society, in terms of societal changes, in terms of some of the things which are shaping not only our present, but certainly our future, and some of them have been mentioned, artificial intelligence, but to name one, and all the ethical and societal issues that these technologies bring about, the challenges. Again, the Council of Europe is there as a space where some of these challenges can be addressed and where responses can be given in a way which is human rights compliant, and is therefore not surprising we have the first and so far the only international treaty on artificial intelligence. But I think despite these challenges and the crisis where we find ourselves, and crises of all sorts, there are also opportunities to make sure that we are on the right side of values, on the right side of fundamentals, that we don't start from zero, that we don't have to reinvent the wheel. Our bases are there, our fundamentals are there, and they are not just from the last 50 years. They come from lots of centuries of experience, knowledge, and as I said, some of the words we're using are not new to ourselves. They were thought by very wise people thousands of years back. So this is where we are. So we have an opportunity. We can build on the initiative, the political and courageous initiative of the Italian authorities. We can now raise this to in our context, a wider level, so mobilize the 46 countries. We can do that at a time where social rights have become more critical than before. The Secretary General, in his political initiative for a new democratic pact for Europe, places social rights and the enjoyment of social rights at the core of democratic resilience and societal stability. And this is, of course, is not a new realization. We realize that as social rights, enjoyment of social rights decreases, so increases the mistrust in public institutions and overall even the mistrust in democracy. So the correlation is clear. Part of that, obviously, is about protection and promotion of health, and we have established in a very efficient way, I think, and there's no doubt of that health literacy is part of the solution, and obviously will never be the problem, that health literacy makes a difference to our economies, that low health literacy costs to the provision of public services, and that there are a number of avenues there that can be explored to help us all as a community together to address the challenges that we face. I think the Rome Coalition will be instrumental in making that a reality, and we will rely and continue to rely on the leadership of the Italian authorities to help us steering that process as we move ahead. The next Council of Europe Health Protection and Health Promotion Conference will be on health literacy, likely under the Montenegro presidency of the Committee of Ministers, so I'm pretty sure we can enlist a new government to support the Rome Coalition, and from there on we intend to take it further with your leadership and that of other countries that will join the Rome Coalition. And I leave you with perhaps a last word of optimism. We can together seize this opportunity, ride this momentum, because the moment is critical, because we need to do that because it's right, and because we need to involve everyone. So with that, I also wish to thank you all for being here and contributing to what I thought was a very enriching discussion, one in a series of very useful events that have helped shape the coalition and also raise awareness about the importance that health literacy has and the solutions that it can bring about. Thank you very much for that, and I wish you a nice afternoon. Bye.
Buon rientro a tutte e a tutti, grazie.